Ladies and gentlemen, good morning. First of all, I'd like to thank you all for apportioning time to attend this particular important activity, which is, we call it a grand symposium because for us, or maybe for the Transforming Health Professions Education in Tanzania project, we are celebrating the achievements that have been made by the project through the years, but also we are marking the transition from regular project activities to what we would call embedding these activities within the university functions, day-to-day activities of the universities, to ensure that we improve the quality of training of our human resources. You will all recall that this particular project came into being as a result of challenges that were observed at the time. I guess even those challenges are still there today. That's why we are continuing
with implementation of activities as we transition to the everyday, day-to-day activities that we are supposed to be doing in our training institutions. And the challenges that were observed at the time include lack of a harmonized teaching curricula for health professionals. And when we talk of lack of a harmonized teaching curriculum, we are talking of the basic minimum of what a health professional graduate from a particular discipline is expected to know and do, This wasn't available for the entire country, in the sense that this resulted into variability in the quality of our graduates, because there wasn't a harmonized curriculum that somehow guides what should be the basic minimum for a particular graduate in a particular discipline regarding what they are supposed to know and do. And therefore, we are talking of lack of the basic minimum skills, the basic minimum competencies, the basic minimum practical ability of the graduates that are supposed to be in place in order for these graduates to practice better healthcare delivery. And we all know that our graduates practice in the same situation whereby they are addressing healthcare needs that are similar across our populations. And therefore, the need of having this type of harmonized curriculum was imminent. But all this was happening in a situation where we have shortage of academic staff. And also, leaving alone the shortage of academic staff, the academic staff that are teaching may not necessarily be trained to become better teachers. This was also a problem. If you ask me, for example, when I joined medical school and when I joined teaching as a member of faculty, I wasn't a typical teacher. I wasn't a typical teacher. I wasn't trained as a teacher. But I am supposed to train others. And therefore, in order to do that well, you need some kind of skills and competencies to become a better teacher. And therefore, this was also observed that the quality of teachers or the quality of teaching may not be up to the required standards. And therefore, this was also a challenge. But at the same time, we will notice that if you do not have a harmonized curriculum, it may be difficult for students to transfer from one institution to the other. And this is also a challenge if you do not have a harmonized curriculum. And therefore, based on these challenges, it was necessary to attempt to address them. And therefore, a consortium of 5 institutions was formed way back in 2017, 2018 to address these challenges. And this particular consortium is composed of individuals from BUHAS, individuals from KCMU, individuals from MUHAS, in collaboration with 2 American universities, that is the Duke University, but also the University of California in San Francisco. May I take this opportunity to introduce to you the members from KUHAS. Can I please have individuals from KUHAS who have been working on this project for years, since its inception? Maybe they can just mention their name, please, so that we can get to know them. I can see Professor Mshana there.
Yeah, thank you. My name is Stephen Mshana. I was the investigator on this project. Morning. My name is Peter Abai. I was monitor and evaluation.
Good morning. My name is Rose Liza, investigator and also M1 and 3. Thank you.
Thank you. Yes, thank you. May I also take this opportunity to introduce to you the KCMU core team, starting with Professor seated on the other side.
Good morning. I'm Landina Teofilimbaga from KCMU core and KCRI. In this project, I was working on AM2 as senior mentor.
I'm Jenny Rogati, Dean Faculty of Nursing at KCMU core.
Thank you.
Ahazi Kulanga, Administration.
Thank you very much. May I now call upon the MUHAS team also to introduce themselves quickly. Maybe we start with the coordinator here.
Good morning. Doreen Mloka, AM1 and 2.1.
Good morning. Lilian Isele, M1 and M3.
Good morning. I'm Maiden Moshi, M3 lady.
This is Nathaniel Sirili, M1 and 2 and 3.
Thank you very much. As we continue interacting, we shall get to know each other better. But I would also like to introduce to you the collaborators. We have Professor John Bartlett, who is from the Duke University. If you look into the booklet, you'll see at least his photograph. We also have a team from UCSF, Professor Sarah McFarlane. We have Judy Martin Holland but also Patricia Sullivan. And I would like to ask you to look into the booklet and see at least their photos. And therefore, this particular project was initiated with the main aim of to transform the educational environment for doctors and nurses in Tanzania so that they can deliver quality care for improved health outcomes for all people, including marginalized communities and those people with HIV/AIDS. We are mentioning marginalized communities and those people with HIV/AIDS here because this is also one of the focus, or maybe that was one of the focus of this particular project. And therefore, upon development of this particular okay. So depending on what was developed at the time, this project was, or maybe the proposal was developed and forwarded or maybe submitted to NIH, and NIH funded this particular project from 2018 to 2023 for 5 years, but there was a post-extension that has extended the project till to date. I would like to mention that this particular project is what we call a multi-PI project, meaning that the leadership of this project is under 2 principal investigators, and I would like to recognize the immense contribution that has been done by Professor Efa Takaya, and I should say that he was supposed to be here today, and if you see the initial flyers, he was supposed to deliver the keynote address. But now we are saying, I was joking with Professor Doreen, saying you are now Professor Kaya, not Doreen. And therefore, she will be representing Professor Kaya delivering the keynote address. And therefore, for ease of communication, for ease of implementation, the implementation of the project was divided into 3 aims. The first aim was dealing with matters of curriculum development, but also matters of how this curriculum can be implemented, and therefore was associated with issues of e-learning. And aim 2 was dealing with faculty development, that is faculty excellence. How can we have better teachers? But also accompanying this was the question of enhancement of research among young researchers. Enhancement of research among young researchers. Hello? Yes, enhancement of research among young researchers. And therefore, we are talking of community young research peers, the details of which will be presented to you in due time. But also the third aim was to deal with dissemination of our activities and outreach activities, so that we can have stakeholder buy-in in enhancing the quality of our activities. But also, this particular aim 3 dealt with issues of creation of alumni communities. Creation of alumni communities in the sense that the graduates have to come together to be able to identify their needs, to be able to identify their continuous professional development needs and other needs, but also create a database that is easily accessible by anyone who would like to know where are our graduates and what are they doing. And therefore, by creating this particular database, it is possible to at least know the distribution and activities of the graduates wherever they are. And therefore, during the introductions, you may have heard people saying I was working in M1, M2, M3, and these are the aims that were in place so that the implementation of our activities within the program could have been made smoother through this aim approach. And for each particular aim, there is an aim lead who oversees the implementation of activities within that particular aim. And therefore, during the subsequent presentations, especially when we discuss issues to do with the outcomes and the outputs of this particular project, these will be presented on the aim basis. I guess this session will follow after the panel discussion. One issue which I have to mention is that this particular, you will have noticed it that we are talking of launching the THET Academy. And by this we mean there will be an activity when the guest of honor comes that will enhance the sustainability of faculty excellence, meaning that the activities that have been done or are continuing to be done as regards faculty excellence will now transition into an academy that will continue doing the same, and this will be owned by you. You'll be owning this, you'll be running this, so that the issues that have been realized within faculty excellence can now continue through the academy, which is an area where people or faculty or trainers in health will continue working to ensure that the quality of training is sustained at all times. Ladies and gentlemen, with these few remarks, may I once again say thank you very much for joining this particular symposium. And most of all, we are here to listen and gather a lot of thoughts as regards the best way of sustaining these activities, but also looking at which ones can be scaled up to other training institutions, so that at the end of the day, all of us attain our ultimate goal of training quality human resource for health in Tanzania. Thank you very much.
So thank you very much, Professor Gideon Asante. So I'd now like to call to the stage Dr. Doreen Mloka, who is going to give a keynote speech on competence-based education in higher learning institutions. Specifically, she'll be talking about the past, the present, and where we're going. So you're very much welcome. Naomba nirekebishe kauli yangu. I would like to make some few amendments. I've just been informed that she has been promoted from a doctor to a professor. So, karibu.
Good morning, everybody. As you know, my name is Dorini Mloka. I'm not a Fatakaya. So if you're expecting a Fatakaya, please be disappointed, because I'm a size 3 and he's a size 7 shoe. So I'm going to try best to fit into his shoes by making this presentation on competence-based education in higher education, health training, the past, the present, and the future, on behalf of the THET Consortium, because this was the cornerstone of the THET project and initiated the development of the project as a whole. So I'm going to talk about competence-based education for health profession, the overview of the past regarding CBE. We're going to talk about the Flexers Commission, then we're going to talk about the Lancet Commission, and then we're looking at the challenges that the THET project tried to overcome as a result from the findings of the Lancet and the Flexner, and then we're going to look at the future of health profession education, particularly CBE in Tanzania. So why are we going through this? Were medical schools not teaching competencies before? Yes, they were. But the number of competencies were limited. The type of teaching was more theoretical, knowledge-based. Clinical skills were being taught, but the assessment was not thorough. You could not measure the level of assessment. You could not measure if a student was a novice or an intermediate or an expert. So there were no comprehensive assessment tools. And new competencies like professionalism, ethics, communications were not primary competencies of health profession education. It was mainly based on knowledge, skills, and attitude. So the current emphasis of CBE is a comprehensive training, assessment, and education of health profession. It covers all aspects, the new aspects that health professions need to gain to be able to do their jobs properly. So two major milestones during the 20th and 21st century revolutionized health profession education. And these were the Flexner Commission of 1910, that revolutionized medical education in the North American region, and the Lancet report of 2010 that emphasized the need for reform in health profession education globally to meet the needs of the 21st century. So I'm going to briefly describe these two milestones in health profession education. So the Flexner Commission of 1910, which was launched by the Carnegie Foundation, and the primary objective of this was to assess the quality of medical doctors in the United States and in Northern America. So what brought this on? There was a report that the quality of medical doctors was deteriorating. There was this idea that they need to standardize and ensure that physicians were adequately trained in different health institutions. And there was a need to inform the public opinion of health outcomes, of the quality of healthcare quality in the United States and Canada. So this commission was introduced, and what did they find? They found that there were inadequate standards for healthcare professionals, especially medical doctors. Poor admission standards. Each university had their own standards for admission. There were poor facilities, and the clinical teaching was not harmonized. On top of that, medical education was not based on scientific principles and had no strong foundation in biomedical science. They looked at the curriculum, and they said the curriculum, there was limited laboratory work, and the required clinical experience was lacking. And the schools that were training medicine, some were small, some had no reputation, with overall poor quality of medical education. So, and that medical schools evolved separately from the unified or required university system of accreditation of training and learning that was done by other programs like law, history, or engineering. So the commission recommended that curricula be redefined and reformed. There is a need to develop standardized curriculum that integrates basic science with clinical practice, and there is an emphasis on rigorous scientific training. And they require that medical schools need to have an accreditation standard. So there was a need to establish rigorous accreditation process for medical schools. Then they looked at the faculty and they made sure that the faculty should be well trained not only in research but in education, and encourage medical schools to embrace research and innovation to contribute to new knowledge and training. So what was the impact of medical in the US and Canada? Well, some schools had to be closed because they didn't meet medical standards. Then the curriculum needed to be readdressed, changed, and refined based on groundwork and modern medical education, and primarily had to focus on outcome. What can the medical student or nursing student do upon graduation, not only know? And then it led to the development of formal accreditation processes of medical schools, and medical schools became part of universities and developed teaching and learning hospitals for their graduates. The long-term effect of this commission was improved quality of education, focus on evidence-based practice, and reforms in other health profession schools that aligned to this commission, and that it influenced global initiatives to improve medical health profession in education worldwide based on these findings. So this was one of the outcomes. After what happened after the Flexa Commission, well, other researchers came in and developed competence frameworks. People are asking, what is competence? Well, these are just structured guidelines that outline the necessary competences for health professionals. What are the minimum core competences that each profession needs to have? And there are several of these worldwide. There's CanMed Frederick of Canada. There's the Accreditation Council of the Graduate Medical Education, ACMG. Competencies of the US, and there's the Entrustable Professional Activity, EPAs, which is a global framework that has been adopted. These frameworks have been adopted widely by medical and health profession. Some of them they have combined some of these frameworks, some of them have used them individually, but these are now the accepted practices or frameworks that are used to treat medical and health profession education. So what do these frameworks focus? CANS-Med 2005 focuses on 7 physician roles: the medical expert, the communicator, the collaborator, the leader, the health advocate, the scholar, and the professional. ACMG 2001 of United States focuses on 6 core competencies, and these are patient care, medical knowledge, systems-based practice, improvement, interprofessional communication, skills, professionalism, and systems-based practice. The EPA's 2001 focuses on specific tasks that the trainers must be able to perform independently upon graduations. And they have like 70 of these tasks that they have to perform. Many countries have adopted AV-CAM-MEDS or ACMG, or made a hybrid of the two to make their competency very good. In the case of THET Consortium, we developed 9 core competency, which is a modified ACMG competency framework that is specifically adopted for the Tanzanian and East African region. So what is the importance of these frameworks in CBE for HPE? The most important is the program meets the needs of the healthcare system. So each framework must meet the healthcare needs of the particular country or the particular region. So you adopt it based on your particular needs. Secondly, it makes sure the curriculum are harmonized, not standardized, so that there's a minimum core competencies that all graduates in the countries must achieve. But it does not dictate to university to have the same competencies. Only core ones have to be the same. The other ones is at the discretion of the universities. The other thing, it ensures that assessment of competencies are viable, are reliable. The major thing that happened in Tanzania is that we had different universities, different graduates with different competencies. But they're all being assessed on the same thing, oscillation, palpated, but they have different skills because the assessment measures were not rigorous enough to assess them if they're novice or the beginners. But it also encouraged students to guide in continuing professional learning. CPD, always strive, lifelong learning, teach yourself more, improve your knowledge. So this is what the competency framework for HPE is all about. So what does this framework have on professional education? It prepares graduates to work. It does not prepare graduates to know. It prepares graduates to work and work in all areas that they are required to work. Is it urban? Is it rural? Is it in industry? Where do they work? It improves patient care. So high quality care and patient safety are mandatory. But the framework allows adaptation to evolving healthcare needs and technology. Science is changing every day. We're using AIs for doing everything. But this curriculum is flexible, or the competency that you can integrate that with it, or other skills that may be required allows the profession. So the next milestone was the Lancet Commission of 2010. This was a major milestone in health profession education. And how did it help? It was appointed to address the changing health needs. The evolving changes required a workforce equipped with new skills. Doctors, nurses of Florence Nightingale era are not the same now. They're required to do the clinical work, they're required to counsel patients, they're required to adhere, they're supposed to do develop research proposal, develop research, quality improvement. These were not the skills that they had in the beginning. So there's also global health inequalities. There are disparities in healthcare. You need to improve education so that people can treat and care for patients where they don't have the resources of other people, or they don't have the conditions that you have, or the infrastructure. And then there's the technical advancement. At the moment, everything is technology-based. We didn't have AI equipment, we didn't have ultrasounds, we didn't have MRIs, we didn't have anything, we didn't have computer-based system. So now health professions need to train to be able to use these training methods and equipment in order for them to be able to be competitive. But the major insight is interprofessional collaboration. Many of the training in the past is that doctors trained in silos. Nursing trained in silos, pharmacists trained in silos. But for comprehensive care, you need interprofessional collaboration. Everybody has a play to role. Who does the diagnosis, who does the social bit, who does the counseling, everybody has to work together. So, but in the teamwork has not been really emphasized. But when the graduates leave university, they're all expected to work in a team, but they don't know how to, because they've never been trained in that way. So this commission identified those gaps, and it tried to address them through different reforms. So the key finding is inadequate training models for current needs. The way we trained our graduates were inadequate, the traditional methods don't work, and we needed to not focus on knowledge. We needed to focus on skills plus attitude. Before, it was only knowledge and skills, and specific skills that were missing were critical thinking, scientific inquiry. So our students are always told that they are robots, they don't think. But we needed to make them train to be critical thinkers. And then we needed to restructure our curriculum, that we had interprofessional education. Our ward rounds would be doctor, nurse, pharmacy, laboratory scientist. So they learn from the beginning that everybody has a role, and everybody recognizes everybody's roles and respects the roles. And then we needed to make sure that they learn how to make decisions needed for lifelong learning. Medicine changes, health profession science changes. We needed to make them lifelong learners, and we needed to make them critical thinkers. But the most important is we needed curriculum that would work in our context. Not that we adopt curriculum that have been made in the US, that have been made in the UK, and bring them down. We needed to make curriculum that will work in the Tanzanian or regional setting and be applicable. So from the recommendations from the Landsport, we needed to shift our education to competency-based and emphasize skills and outcomes. We needed to work in the health system. We needed curricula that align with the health system, that encourage collaboration between educational institutions and health authorities. We needed to emphasize that in the new curriculum there is fostering and opportunities for interprofessional collaboration and training. We needed to improve our curriculum by engaging the community and the global environment. When we were making curriculum in the old days, it was just us, the faculty at the university, developing something and going. But now we need to engage the stakeholders. What do our patients think of our curriculum, of our graduates? What do the ministries think of it? And we involve all the relevant stakeholders, including the speaker, to make a curriculum that is effective, acceptable, and implementable. And then we need to use technology, and I think COVID taught us a lot. At the end of COVID, in the COVID era, universities shut down because we're not able to use technology to teach. But we can use technology to teach even in eras of lockdown and exam. And make sure that our students are always willing to learn more and learn more. So what is the status of implementation of the Lancet report? Well, some countries have tried to implement the report findings. And I talked to Tanzania. We started at MUHAS, with the UCSF LAP collaboration, the academic learning project, was run 2008 to 2011. And this project actually built this building, Chipe. So this was the academic learning project. In this project, we transformed all of MUHA's curricula into competency-based. That was our first step. And then we also KCMU Core under MEPI, institutionalized medical education and research. So this was the first time when medical education was this. And through the THET project now, we have made some more reforms in faculty development, medical education, and curriculum reform. But challenges still exist. Making curriculum reform is an expensive business. So many universities, even locally, have not been able because they lack the funding. Maybe they lack the infrastructure and even a human resource. But the main reason is resistance to change. People like to go to their old ways of lecturing and lecturing and lecturing. So that was the main thing. But there are various organizations around that are still looking to support universities to adopt the Lancet report recommendations. But to remember, pandemics, COVID really brought into home that our curricula must change to be able to run even with even with inadequacies. And I think THET tried to harness on this objective. So what happened after that? Well, there's increased adaptation of the findings from medical and nursing and allied. Now, core competencies have been introduced in many health profession schools, especially medicine and nursing, pharmacy, all over the world. And the emphasis on skills, professional knowledge, communication, and practice-based learning improvement. And assessment methods, which were the major crux or hurdle in assessing students, have now been outlined. And we now use formative and summative assessments in CBE. So more application of objective structured clinical exams, objective structured practical exams, portfolios, mini CXEs, etc. So what were the challenges that THET wanted to tackle after reading the Lancet Commissions and the Flexen report? Well, in Tanzania, we had a mushroom of universities that are training health professionals. Some were implementing CBE, some were not. Then the faculty teaching at these universities, some had faculty training, were trained how to teach and how to assess. While some faculty, you were just employed because you had a nice GPA and you were taught how to teach. You were said, okay, here's the class. Then there were not sufficient resources. We needed simulation labs. We needed online formats to teach. Resources were scarce, including faculty, as Professor Kosugaba. But the other thing is resistance to change. When we started the ALP project, one of my seniors says, you want to teach me how to teach? I taught you. So it was just a quirk, you know. He says, you want to teach me how to teach when I taught you? And it was like, I'm used to my way, I don't want to change. So that's it. And then the use of appropriate assessment methods. Some of the assessment methods are subjective. Long case, short case. And some of them are subjective, and you need multiple assessments to assess a student. And sometimes people are only assessed once or twice, and this makes it. And then there's limited collaboration with healthcare providers. Even in our wards, we know the nurses know a lot, they know how to take vital signs. But we don't use them to teach. When we could that, we want to teach everything ourselves when there's an expert. There's an expert. We don't collaborate. You want to talk to the pharmacist who's the drug expert and the drug interaction, you don't. And then the curricula. Some were input-based, some were competency-based, and some had competencies, some had no competencies. So the graduates were coming out were very different. If you look at the registration exam or the intern exams, you get some universities are passing, some universities are failing. But when you look at the curriculum, you think, but they're similar. But it's not how you teach it, it's what the students learn and how you assess it. So people were not assessing them correctly. So THET Consortium tried to address these challenges through a number of initiatives. First, the institutionalized health profession education and faculty development program. At each of the 3 consortium universities in Tanzania, KUHAS, KSMU, KOHA, we have a health profession education center or unit. And this unit holds what we call the faculty developers, known as HPEGs or CPEGs. And I think some of them are here. Can I ask the CPEGs and HPEGs to stand up, please? So these are our HPEGs and CPEGs. Their job, please sit down. Their role is to teach faculty how to teach and assess. So they have gone under rigorous training to teach and assess. Clinical teaching, theoretical teaching. So they teach other teachers, this is the right way. When you're doing a mini CXCs, this is the way you should teach it, and this is how you assess it. Then the TET also allocated resources to educational technology. All the 3 institutions have lectures, sessions online. We're using e-tools to teach. We're using e-tools to assess. Okay? We're creating videos for learning. So these repository, and we are sharing resources. So now KCMSU has a good video to teach counseling of HIV. MUHAS can borrow it. You don't have to duplicate the wheel. We are sharing resources. We're sharing facilitators using the e-framework. Then we've improved assessment methods. We mapped our curriculum and aligned all assessments. So what are you assessing? Is this a novice? Is this intermediate? Is it a beginner? And how do you assess this person knows it, can do it, and can master it? So we've aligned our assessment methods and our assessment to align with the curriculum. Thirdly, the MD and nursing, the MD and nursing curricula have been harmonized in such a way that the nursing and medicine students can work together. There are opportunities for interprofessional education. So they can go on ward rounds and they can share experiences, and this way they can. For we have tried to make sure that. And when we're making the curricula, we made sure that all the stakeholders, TCU, the ministry, the community, the patients, all gave their inputs into the curriculum to make it a curriculum that would work. And now we have a harmonized curriculum template among the 3 universities. 80% is the same, 20% is at the discretion of the university. So some people are specialized in research, some in dermatology, So these frameworks have now been benchmarked and are used to make other curriculum. So how did the project address policy and regulatory? The outcomes of the THET initiative achieve an instrumenting certain policies and regulation, particularly the Education and Training Policy of 2014, edition 2020, which calls university to transform curricula to CBE. So we have now transformed into CBE curricula. So we're trying to align with this policy. Outcomes are also trying to like the HFO directive that the Health Profession Training University adopts competencies. So we're in line with WHO requires. And then the regulations that we need, the regulations are that of East Africa and regional that request locally and regionally to harmonize curricula to meet the East African community as a era infection. So we are on the roadmap. We need to still align with the other universities in East Africa, but this is one step that we're getting there. So how does the future look like? So the future of CBU will be dominated by the following. Trends to watch. How do we increase use of technology? How do we use simulation, 3D animated system to train our students remotely? How do we give them access to university treating? Does everybody have to come here? Can we do it remotely? We are going to work on greater emphasis on personalized and adaptive learning, student-centered. The student should be the one driving the learning, not the faculty. They want to learn and they want to know. We're going to work more on sharing best practices and resources across borders and across nations. We're going to focus more on harnessing and measuring the impact of CB on patient care and health system. Our graduate outcomes actually improving healthcare, okay? Our index is reducing. But we are going to emphasize to cultivate the culture of continuing professional development, because this goes without saying, because learning never stops and they need to have this culture. So sustaining the THET initiatives, we request that the leaders own the products of the THET consortium and address and solve local CB challenges. We request the adoption of the MD and nursing benchmarks to transform health profession training programs. For other programs, pharmacy, I don't know, lab, BMLS, whatever. And at this session, we're going to launch the TEA Academy, the Tanzania Health Educators Academy, to sustain faculty development and educational initiatives, the initiatives of the HP program. To conclude, I just want to say CBE evolved from Flexner, but to present has significantly shaped key developments practically after the Lancet report. The THET competence framework structures ensure health professionals are equipped with the necessary competence to meet the demands of modern healthcare. And to sustain the CBD development in Haiti, institutions are called upon to adopt THET initiatives and guide the process, particularly for other programs, internship, and workplace learning. Thank you.
Makofi tafadhali kwa Professor Doreen. So thank you very much, Professor Doreen. I think, you know, you cannot summarize the things that have been done in 5 years in a 5 minutes presentation, but I think she's done a great job in doing that. So many congratulations to you and to the whole team for leading these efforts. So we are going to quickly transition into the next stage, which will be the poster viewing. So there has been a slight change to the schedule as we await for the breakfast to arrive. So we'll go into the poster viewing for 15 minutes. And I would now like to take this opportunity to request the CYPs if they could move outside and go to their poster so they could actually tell us what do their poster means. So in the next 15 minutes, we'll be going out for the poster viewing sessions. The poster boards are just down the hallway. Kwa hiyo karibuni sana. Ninawaomba CYPs waende nje, wasimame kwenye bodi zao ili waweze kuwaelezea watu maana ya poster zao. Thank you very much.
Just kulingana na wewe.
Good morning. Okay, so welcome back. So the guest of honor has arrived, and I think he'll be joining us. He'll be joining us in the next few minutes. So nilikuwa naomba tukae tukimsubiri mgeni rasmi kuingia. So the guest of honor has already arrived, and he will be joining us in the next few minutes. We may now take our seats. So distinguished guests, faculty, dear friends and colleagues, a very warm good morning to you all. It's a privilege for me to be standing here to moderate this event. And I would like once again to thank you for making time to come and join us in our grand symposium. And without wasting much of your time, I would now like to call Professor Gideon Kosigabo, who is the principal investigator of the THET project, to come and give a few introduction words before we proceed. Welcome.
Thank you very much. The Honorable Guest of Honor. The Honorable Guest of Honor, Professor Peter Msofe, and all the distinguished guests, the Vice Chancellor from MUHAS, the Vice Chancellors present here. We have representation from the following bodies. We have FUCS, which is an association of training health institutions within Tanzania. We have the Kampala International University represented. We have KUHAS represented. We have KCMU co-represented. We have Aga Khan represented. We have Hindu Mandal Hospital represented. We have MCT, the professional body, but also we have the Pharmacy Council. HKMU is also represented, together with other institutions that include the news media outlets that are also here. Honorable Guest of Honor, in front of you are participants on the Grand Symposium, and this particular Grand Symposium is about the Transforming Health Professions Education project that has been running for the past 5 years with a 1-year extension from last year to end of August this year. And the purpose of this particular project that has been implemented for the past 5 years was a response to the challenges in the training of our health workers or health graduates. And the following observations were made. One, lack of a harmonized curricula. And when we talk of a harmonized curricula, we are talking of a curricula that encompasses all the basic minimum competencies and skills that are supposed to be acquired by a graduate of a particular discipline. And in this case, there was a challenge that these competencies and skills and knowledge were not harmonized. And this resulted into graduates with varying competencies across the region, across Tanzania. And therefore, this brought a lot of, maybe I can say, inadequacies, in the sense that if you have graduates who do not have similar competencies, it means even the healthcare delivery systems cannot function the way they're supposed to function. But also there is this question of lack of transfer of credits from one institution to the other. But also this was compounded by the fact that the teachers who run this competency-based curriculum, or the curriculum which were not even competency-based, do not have the necessary skills or qualities to train and implement those types of curriculum. And therefore, a consortium was formed comprising KUHAS, comprising KCMU, comprising MUHAS, in collaboration with the Duke University and the University of California, San Francisco, to address these challenges. I would like to say that this particular project has been led in collaboration with 2 PIs, that is a multi-PI type of project. And therefore, I'd like to recognize the immense contribution that has been provided by Professor Efa Takaya in this particular project, who was the initial PI of this particular project, and later he moved from the primary institution to KCMU core, and therefore I had to come in to do the activity, but it still holds the multiple PI arrangement. And therefore, after implementation, today we are sitting here to share the accomplishments made from the project, together with sharing the lessons learned, and at the same time we are assuming that there will be good issues that may be adopted by other institutions. Lessons to learn, but also the best practices that can be adopted by other institutions. And therefore we are talking of transitioning from what we have been doing in the project to the day-to-day activities that enhance the quality of training within our institutions. And therefore, by the end of the day, we are assuming that there will be issues that will be acquired by other institutions in terms of scaling up. And before you came, Honorable Chairperson, we had this presentation which was about the history of competency-based education in Tanzania, gathering experiences from what happens across the world. And therefore, with these few remarks, may I call upon the MUHAS Vice Chancellor to come and deliver his remarks before, in turn, inviting the guest of honor to deliver the opening speech. Please, MUHAS Vice Chancellor.
The guest of honor, Professor Peter Msofwe, the Director of Education, Minister of Education, Science and Technology. I believe we have the representative of the Executive Secretary of Tanzania Commission for Universities here. But we have the Director of Training from the Ministry of Health. We have the Vice Chancellors from partner institutions or representative of the Vice Chancellors, Provosts and Principals. I believe we have other representatives from the ministries, but also we have representative of the Registrar of the Professional Council. We have Deans, Directors, Heads of Department, THET Consortium members, invited guests, dear participants, ladies and gentlemen, good morning. So guests of honor, first of all, let me take this opportunity to thank you very much for coming to grace this symposium. As we have heard from the coordinator, Professor Kwesgab, the objective of the consortium have been explained. So we really thank the Minister of Education, which is our parent ministry, for accepting to grace this important occasion, which is geared towards improving higher education in Tanzania, and particularly in health sciences. I believe those who are here from this morning, the history of competence-based curricula was provided. Professor Kwesgabo has given the partnership background, the institutions that are collaborating in this consortium, but the rationale, why was this consortium established? The need to have competence-based curricula in health sciences to make sure that we have harmonized the curricula that will allow mobility of credit transfer, competencies of teachers, as well as strengthening collaboration among the institutions. We have heard and we shall hear more about the accomplishment of this project. As the Vice Chancellor of MUAS and as a member of academic staff, I must say that as an institution, we have benefited a lot from the accomplishment of this consortium. This project is the continuation of the project of the collaboration between MUAS and the University of San Francisco, which started, I think, around 2013, 2010. And I remember I was one of the beneficiaries of this collaboration, where I was trained as health educator. So this continued to this consortium where teachers, academic staff are trained to be teachers. So I must say at MUAS, and I believe in other partner institutions, we have already created groups of educators, which is a very key. So people have been trained how to train others, especially in competence-based curriculum. So this is one of the achievements. So we have a group of trainers, and these people are available to be called upon to train in any other institution that provide a sciences education. But it was mentioned also some ICT systems have been developed, and one of them is the portal that will allow an institution to communicate with alumni, the graduates of that institution. And I am told this also could be done within the consortium, that you create a group of alumni, which are very important to provide suggestions, guidance to improve education in the institutions. So those are among the few deliverables, but I believe through this project, the quality of education in health sciences has improved. The documents have been developed, guiding documents, curricula competence-based are available, and other products and services that are produced through this. So we believe what the consortium has done, this will improve the higher education sector. So guest of honor, being the director of higher education, I think this is very important for the directorate, because this will create a benchmark where other institutions can learn to improve their quality of training in higher education. In Tanzania, we have quite a number of institutions, including universities and colleges, that have established programs in health sciences. So I believe those institutions can benefit from this program. So, guest of honor, I would request the members of this consortium that probably at the end of this symposium, they prepare a short recommendations, a brief recommendations on how other institutions can benefit from the outcome of this project. But also recommendations to the Minister of Education on how best can training in higher education, is particularly in health sciences, can it be improved. As I said, for us, we see improvement. We see improvement in the way we are implementing our curricula. You start looking at the way you implement it. You develop the curriculum, the competence-based. You define the competencies. Then you define instructional methods. How are these competencies have to be implemented. And then you design assessment methods. How objectively should assessment be conducted? And these range from different ways. This could be people who are doing training through the lab, people who are doing clinical work, people who are doing classrooms, people who are doing field work. So there are a set of competencies that have been developed, instructional methods. You have a smaller class, a larger class, and then the assessment methods. And through this, the guest of honor, we have seen the quality of training has improved. So this is a major achievement of this consortium, and we congratulate the team, but most importantly also we congratulate our partners, the Duke University and San Francisco, but also the funder. Professor Kesgaba, I did not hear you mentioning the funder. This project was funded, so we needed to acknowledge the funder who supported this project, and this indicates that some of the funding agents, they can make a difference in higher education, and this is one of the areas where we should be proud of our collaborations, partnership with those institutions that have already been developed compared with others. If you go to San Francisco, you look at their curricula, the way they teach, it's well advanced, and that's the experience that we have benchmarked. So once again, guests of honor, thank you very much on behalf of the Permanent Secretary for coming here this morning to grace this occasion. And I believe the outcome of this symposium today will be documented to make sure, as I said, these recommendations are compiled and are submitted to the ministry to make sure that the good outcome that we have seen in this consortium also can be utilized by other higher learning institutions. So, guest of honor, with those few remarks, let me now invite you to talk to this audience, and I request then that you officially open this symposium. Karibu sana.
Professor Apolinari Kamuhabwa, the Vice Chancellor of Muhimbili University of Health and Allied Sciences, Director of Training of the Ministry of Health, Dr. Liza, Professor Emmanuel Balandia, Deputy Vice Chancellor for Academics here at MUHAS, Professor Erasto Mbugi, Deputy Vice Chancellor for Administration and Finance here at MUHAS. I'm told that there will be a representative from the Tanzania Commission of University. I recognize your presence. I recognize the presence of Vice Chancellors, Deputy Vice Chancellors, Directors, Principals of various colleges who have been invited to this meeting. All higher learning institution heads who are present, Deans, Directors, Principal Investigator for the project, Professor Wesigabo, THET consortium members, invited speakers, dear participants. I see a number of members from the media, so I recognize your presence. Ladies and gentlemen, good morning. Hey, you seem like you've just woken from the sleep. So should we maybe do a small exercise before we continue maybe? Or let me try again. Good morning. Good morning. That's much better. It's a really great pleasure for me to be here before you at this very significant symposium. And the name explained is a grand symposium, not just any other symposium. It's a grand symposium. I didn't know that there was actually levels of symposia. So today I learned that you can have a small kind of symposium, a middle level, and then a grand symposium. This is a grand symposium, so it's really an honor for me to be here with you. And this symposium is talking about transformation. So it's a transformative kind of symposia. So I thank very much all people who made this possible. First of all, I want to congratulate the Muhimbili University of Health and Allied Sciences, first of all, for being the mother of all health institutions in Tanzania. Give yourself a hand. If anybody is going to be annoyed by this, please forgive me, but that is the truth. That is, most of the people who are in all other health-based universities came from here, or at least were taught by somebody from here. All right? So we congratulate you, Muhimbili, MUHAS. But we also congratulate the presence of Catholic University of Health and Allied Sciences, KUHAS, and KCMC Co, in collaboration with Duke University and the University of California, San Francisco, for this collective effort. It's not very common to see public institutions partnering with private institutions in this country. I don't know why, but it's not very common. So this is a very, very welcome and a very significant move, and I congratulate that. The dedication, the hard work, and the unwavering commitment that you put into this initiative, which sought to improve healthcare services provision to the people of this country and beyond, is highly commendable. We all understand that by enhancing the education of our health professionals, we're not just improving their knowledge, skills, and competencies, but we're also investing in the future of our nation and the well-being of our nation. After all, the quality of healthcare delivery in Tanzania is directly linked to the quality of education to our healthcare professionals. Now, this transformative work done by this project is congruent to the current transformative initiatives in education in Tanzania. You will note that in 2023, that is last year, the government approved a new education and training policy of 2014 version 2023. And because of that, a lot has happened. One, there's been a change in the curriculum at the lower levels, starting from primary school, secondary school, and teachers' education. But also at the higher level, we also have started doing curriculum, either review or development of new curriculum. Now, the development of new curriculum, which is based on the new education policy, match very well with what this project has done. So you have actually set as a benchmark for other people to go and look into. So you've done the donkey work. Other people will just come in and reap the fruits of their project. So congratulations once more. Now, the Tanzania government is working tirelessly to improve enrollment of students at all levels, from primary school, secondary, all the way to higher education, to address its ailing net enrollment and gross enrollment ratios, which over the years have been relatively low in the East African region. Now, the rapid expansion of higher education in Tanzania, driven by the deliberate government actions, has indeed opened up new opportunities for many students. However, the increased enrollment and increase in higher learning institutions in Tanzania has also raised some concerns about the potential compromise in the quality of education. Now, let me pause here a little bit and tell you something about the quality of education or the standards of education. Because, you know, when you talk about the drop in the quality or the increase in quality, those terminology cannot be placed in numbers. They are highly qualitative, and qualitative statements sometimes can be dangerous because they can make you feel that if you trained as a medical doctor 3 years ago, you were trained at a lower level compared to somebody who trained today, or somebody who trained in the last 20 years. The fact of the matter is, quality standards is a decision, is an agreement. What you agree now, that is the standard, is the standard. So if you were trained last year, don't feel smaller than somebody who is training today, because you were actually trained. The only thing that you need to do is that, because we say elimu haina mwisho, education has no end. Keep on learning yourself. Jiongeze. If you feel that you are lacking some areas, go ahead and try to put yourself into those tracks. But don't feel inferior, because there's a tendency of, when we discuss about elimu imeshuka, it's a scary word when you talk about the education quality has dropped. You feel like, should I go to see the doctor who graduates this year? Will I get the same treatment? Yes, you are going to get the same treatment. So, ladies and gentlemen, in health professional, the establishment of a private higher institutions of health and allied sciences in Tanzania through the late 90s and early 2000s sparked the creation of additional universities, university colleges, and bringing the current total to 12. There was only one. And it actually started as a college, and then it went up into a university. There was one for some years, and then now there are 12. Now, one thing Muhimbili can be proud of, even the 12, Muhimbili has its hand written all over the 12. If I start mentioning the vice chancellors, the principal, the provost of all these other universities, I don't know, probably all of them will either have been here or have been taught by somebody who came from here. So Muhimbili, feel proud once more for being the mother of all health universities in Tanzania. Now, the rapid growth in the number of these institutions, unfortunately, it was not matched by a corresponding increase in academic staff or teaching and learning resources. Despite the well-intentioned and urgent need to expand the health workforce, concerns about the quality of graduates and their fitness for purpose was raised by a wide range of stakeholders, including professional councils, regulatory bodies, employers, educators, students, and patients, to mention just a few. But as I said earlier, it's not that bad, Professor. Is it really that bad? Should we be scared to go to hospital? No, we shouldn't. So it is a concern. The word concern is the one that we underline, that it is a concern. And whenever there's a concern, we need to address it. And that is why a project like this one, like the THET, is a very important project, because it's not only noting the concerns, but it is actually putting some effort into addressing the concerns. So the public outcry cannot be ignored. Whenever there's a public outcry, you don't ignore it. You actually look deep into it and try to address it. And it suggests a need for use of innovative approaches to ensure that the growth of higher education does not come at a cost of health professionals having, unmatched educational standards. Ladies and gentlemen, so this joint project of transforming health professional education in Tanzania was aimed at improving the competence of physicians and nurses in Tanzania. The initiative was expected to pave way to a future where the medical and nursing graduate will be highly competent and well equipped to meet the evolving health needs of our communities. Now here again, I want you to note that we are talking about the evolving needs. Even the health professions are not immune to the evolving needs of the current globe where we are living in. Those who trained in the 70s, they could actually form a niche. They could just have a niche of some diseases that they were attending, and that was all. But now things are moving very, very rapidly. If there was a problem in Brazil yesterday, it might be here today because of the rapid transportation that is available. If there was misinformation that was generated in one of the small Balkan nations, maybe Lithuania, it might be here today because of the power of social networking. So the needs of a doctor today are completely different from the needs of doctors yesterday. So I'm very happy to see that the project that you actually conducted was aimed at preparing this doctor into the needs of today, and probably preparing them better for the needs of tomorrow. So this is also a very commendable job. And we commend our partners from the University of California in San Francisco and Duke University for the support of this initiative. In my language, in my vernacular, they say that if you are going hunting, you put ahead people who knows the ways of the animals, because animals leave tracks, and not everybody knows those tracks. So if you're somebody who knows the tracks of a wild boar and you put them in front, you are likely to catch a wild boar than if you go, blinded. So when you have people like Duke and University of California, San Francisco, joining you, mostly they know the ways of the animals. So you are likely to hit the mark quicker than if you are doing it on your own. Moreover, I am also aware that throughout the implementation of this project, you have collaborated across various sectors, from government bodies, academic institutions, and professional bodies to non-governmental organizations, which many are present here today. Each of you have played a pivotal role in shaping the outcome that we celebrate today, and I commend you all. Ladies and gentlemen, I am informed that the project began with a clear and ambitious goal to develop harmonized competence-based curricula for medical doctors and nurses that will set a new standard for health professionals education in our country. As a consortium, you recognize the need to move beyond the traditional methods and embrace a more dynamic, skill-based approach that would ensure our graduates are not only knowledgeable, but also capable of applying their skills in the real-world settings. Over the courses of this project, in collaboration with all partners guided by Tanzania Commission for Universities, you have successfully developed and implemented these harmonized curricula, which are now better aligned with the demands of our healthcare system and the expectations of the communities that we serve. This curricula emphasize not only the acquisition of knowledge, but also the development of practical skills, critical thinking, and deep understanding of the social and cultural context in which our health professionals work. This is a very significant achievement. I want to remind you again that in the 70s, in the 80s, when a patient walked into your consultation room, probably they didn't know anything about the disease that they were suffering from. They did not have any information. They depended 100% on you to tell them what was wrong. Now you have Dr. Google and everybody else coming to your office knowing more, probably more than what you expect them to know. So whatever you say, you are no longer the authority. You are actually measured against other authorities out there. There's famous doctors nowadays. Some who are true doctors, some are quacks, but the public does not know very well how to differentiate between a doctor and a quack. They just know that all of them are doctors. So a doctor that is trained today needs to be very, very articulate on how to handle the pressure of somebody who comes thinking that they know what their problem is, but still come to you for confirmation of what they think their problem is. I don't know if you have experienced that, but I know that that is what is happening, because even when I go to the doctor, I have already Googled to see. It comes naturally, and you can't avoid that. So yes, you need to learn how to deal with that as well, apart from the fact that health problems now have really shifted a lot. You have a lot of non-communicable disease causing more problem than communicable diseases. You have a lot of new and re-emerging diseases coming. You don't even know what, we were talking about COVID-19 just 2 years ago. Now we're talking about Mpox. Marburg is always, around the corner. We don't know when it's going to hit us. So there's so much that is happening in the medical field that you guys are supposed to be knowing all and being able to solve. So when you have a curriculum that emphasize competence and the skills, it also broadens the view of how you can actually be able to navigate unfamiliar territories. Ladies and gentlemen, the harmonized curricula are just one of the numerous achievements realized by the project over the 5 years of its existence. Today, at this symposium, we are going to explore the details of this accomplishment, discuss the challenges encountered, and collectively decide to sustain and scale these outcomes. A significant highlight of today's event will be the launch of the Tanzania Health Educators Academy, a key initiative aimed at ensuring the sustainability of these achievements. I therefore urge all higher learning institutions in the country to learn, to support, and to be part of the scaling up of what has been accomplished through this initiative as a good start in addressing some of the challenges which are very common to all of the institutions on training of health professionals in Tanzania. In other words, this is a good benchmark in curriculum review and curriculum development. I also urge professional council to ensure that These efforts will be sustainable and continue to bear fruit. I'm happy to hear that MCT is here, because MCT is one of the professional councils which really should be the one that are guiding us on the quality of the doctor that is required, or the nurse that is required out there. I assure you that the government will continue to provide support to all higher learning institutions, including those on health, to ensure the sustainability of what has been achieved. Now, ladies and gentlemen, with these few remarks, I don't know if I can call them few, but well, this is how you end your speech, regardless how many words you say. With these few remarks, it's now my honor and singular pleasure. I just remembered something. You know, Dr. Liza and I had we meet in some other meetings, and he has concerns that also are my concerns. So, with your permission, I would like him to just say one word, and then I'll finish the remaining part.
Mheshimiwa mgeni rasmi, Profesa Msofe, rafiki yangu ambaye tunakutana kwenye matukio Dodoma, ni ngumu sana kukutana. Pamekuwa pakubwa sana Dodoma. I'm really thrilled to be here, and your prophecy is very true that most of us, provided you are a medical personnel, is either a product of this institution or had been trained by those who are here. I'm purely a product of this institution for 5 years that I pursued my MD degree. Yeah, and proud to see Professor Kahamba and the like, who were my mentors here. And my colleagues, Professor Kidenya, we graduated together, and etc. and so on. So we are really a cohort of his own, having its ambiguities and differences, but we are all a family of Mohas. Despite the fact that in those days it wasn't Mohas, it was MOOCs. But that the involvement of Muhimbili per se, when it was part of the University of Dar es Salaam. Honorable guest of honor, the Minister of Health is so much pleased that the consortium that was established to have the harmonized curricula really helps a lot. Why? Because it is not acceptable, allow me to say so, to have a doctor, but if you look at the curricula that is producing those doctors from multiple or different universities, it's hard to know that they are all MDs, or they are all nurses, or they are all physiotherapists, etc. and so on. It's very hard. Bearing in mind that the same human resource for health are going to work within the same community, same patients, but having different curricula is a confusion, and it will produce the human resource for health with a huge difference in their skills and capabilities, which at times may even endanger the health of the people that we are serving. The Ministry of Health will keep embracing the good practices that have been shown by the consortium, and it is our wish that maybe this was just being piloted, and now it is going to be cascaded to all other programs and all other remaining universities. The Ministry of Health will avail itself for whatever necessary assist to make this one possible, because we are the beneficiaries, and if something is not good, we are the casualties who will receive the care from the products of the curricula that we are seeing in a lot of universities that are in the country right now. Maybe to share this one, 2 years ago, I represented the Minister for Health in Kenya. There was a huge meeting that was about the health curricula. Actually, what is coming on board maybe in a few years to come is the harmonization of the regional curricula, not even the Tanzania curricula. Now, it will be so sad if the East African community will realize the need of the harmonized curricula, why in Tanzania we failed within the same nation. So I think we better overtake the process so that we can even become a good example in East Africa to lead the others on how to do it. We are looking forward to seeing much of this one in different stages being advocated. And as I said earlier, Honorable Guest of Honor, the Minister of Health is willing to do whatever is within its jurisdiction to this one happening. And we are ready since yesterday to see it coming into fruition for the benefit of our people. Thank you once again for inviting me here. Pleasure. Thank you very much.
I wanted to get that assurance, you know, that last line there where the Minister of Health is prepared to avail itself to this kind of changes. Thank you very much, Doctor, because now I have the comfort of saying, with these few remarks, it's now my singular honor and pleasure to declare that the Transforming Health Professional Education Grand Symposium is now officially open. Thank you very much.
Thank you very much. Now I'd like to welcome the PI1, Professor Gideon Kwesigabo, to come and say some few words before we go to the next program. Karibu.
The Honorable Guest of Honor, I guess the next item is the photography. Yes. So please, can we move on to the photo session? Yes.
Thank you very much. Now we have time. We're going to have some few photos at the high table. And before we go to another session of listening to presentation, we'll have some few photos here. And then we'll ask the guest of honor to just go outside and have a media brief while we are setting for the presentation. And when they come back, they will come and sit here. And we'll have presentation for M1, M2, and M3 so that everybody will have a privilege of hearing what exactly the project was able to do for those 5 to 6 years that has been around. So the first picture is for the high table. I hope that one has already been taken. The second one, I'm asking for all the head of institution around here, if they're head of institution, or please, you can come forward and stand behind the high table. Head of institution, vice chancellor, even if you are representing an institution, please come forward. Head of institutions, please. I know the representative from the ministry are already here at the front. So representing institution, vice chancellors and principals, please. And please, the deputy vice chancellor should go in the same picture, please. Deputy vice chancellors, you can go to the same pictures. Asante sana. The next picture, I'm asking for the HPEG and CPEGs who are around here. HPEG and CPEGs. Can you just come forward? HPEG and CPEGs. Unawakumbuka watu wako. The next one, it will be the community of young research peer together with their senior leaders. The community of young research peer together with their senior leaders will be the next one. And the next one is going to be the consortium pictures. Now all the MLEAD, all the people who are in the management of the consortium from KUHAS, from KSMU Core, and from MUHAS. Everyone involved in THET, apart from the CURRP, but the rest who are in the management team, karibuni sana. Dr. Sabina, I don't see you here. The next one, hii naona ni ya upendeleo. I'm not sure how many we have, deans and director and head of department from MUHAS. Even KUHAS and KSMU. If you have deans and director who are not in the other pictures, you can also come, but you can come as well. From all KUHAS, KSMU and MUHAS, deans and directors. And I have one last one, and this one is the rest of the people who are not in all those pictures. Please, I want to see you. If you're not appearing in any of those pictures, and I'm requesting kindly come forward and have the last picture. This is for. Now the coming one is for the rest of the people who have not been I know we have students we have invited, we have some other participants that we have invited. Tafadhalini. Kwa heshima sana. Najua watu wengi wakiwaambiwa hivyo they don't want to come, but please come. We want to have you. Asante sana. Thank you very much. Now I would like to request the guest of honor together with the Vice Chancellor and the PI and also the representative from the Ministry of Health just to go outside for a few minutes of media brief while we are setting for the presentation. Thank you so much. It will take just a few minutes so that we will go with the time. Asante. ni tofauti. Ile ilikuwa keynote. Ile aliyokutumia nani? Lakini pia mimi nimekutumia sasa hivi. Iko wapi email zako? Open your email. No. Ile alizokutumia nani ziko wapi? Alizokutumia open nikuonyeshe present. Kuja kwanza. Usiangalie. Kuweka hapa.
Nikushusha. Shika hii, ongeza nani kama ni asili shusha katika 18. Haishuki zaidi ya hapo. Inaishia hapo? Haishuki 16. Imefika 16 hiyo? Haifiki 16. Basi acha. Shusha. Hizi nitumiwa na mloka. Itakuwa inataka. Afanya zote. Tumia nafaka leo hii. Hizo nitumia hizi hapa. Hawezi jua. Basi kufungua sijui. Na kufungue. Na unatoa ile inaitwaje sio ndika. Hapo. Karibuni tena. So welcome back again. I will go now into the next session, which are the presentations. So the program had 3 aims, and we are going to listen to presentations from each of the aim. And to kickstart the presentation is Professor Doreen Mroka, who is going to talk about the first aim, which is on improving the ability of physicians and nurses to serve the Tanzanian people. Welcome.
Good afternoon. I'm going to present on behalf of AIM 1, the flagship of the THET project, which had the heading of improving the ability of physicians and nurses to serve the Tanzanian people. And as you can see, the listed AIM 1 members are there. Just a few of them were quite a lot of the curriculum aim. So the objective of AIM 1 was to improve the ability of physicians and nurses to serve the Tanzanian people where they were most needed by agreeing on common minimum competencies and revising and implementing competence-based curricula. Specifically, what we did in this aim, we developed a harmonized... Oops, something went wrong. Okay. Specifically, we developed a harmonized competence-based curricula. And in this aim to implement the harmonized competence-based curricula, we also promoted the use of ICT in the delivery of the curricula. So the approach was to transform and harmonize undergraduate curricula for doctors and nurses in order to make them competent and ready to serve wherever they live, particularly in remote and underserved regions. So how did we go that? We conducted tracer studies, we engaged stakeholders, and adopted base processes to develop the new curricula. And the curricula had 9 THET competency domains, and these were health profession knowledge specific for that discipline, whether medicine or nursing, the specific clinical and practical skills for that profession, whether it's medicine, nursing, and then 7 other core competencies that were harmonized between the 2 disciplines. And these were communication skills, oral, written, communicationship. Their competencies to make relationships with clients, patients, and communities. Their competencies to be able to work in teams, that is inter and interprofessional practice and collaboration. We also wanted them to gain competencies in scientific inquiry and critical thinking. And we wanted them to have competencies in maintaining good practice, is that practice the profession to the best standards that are internationally and locally applicable. And another competency was professionalism and ethics. And then the competencies, they had to understand how to work within the healthcare system of the country and in the context of health. So these were the 9 competency domains. The 2 knowledge and critical were specific for the disciplines. So aim 1.1, our aim was to deliver harmonized competence domain. So how we went out, we first developed generic templates for curricula by the universities. What we did was we benchmarked all 3 curricula, developed comprehensive curricula maps, borrowed best practices from each of the 3 institutions, and then made generic templates that included the tracer study results and stakeholder inputs. From these generic templates, we made individualized curricula, 3 BSc nursing and 3 MD accredited, 2 from each university, that contained student-centered models that promote critical thinking, interprofessional education, and early clinical exposure. And to the state, all 3 institutions are implementing the new curricula. The curricula contain more clinical exposures in rural areas and community practice modules to enhance graduate skills and confidence to practice in university. All harmonized curricula are in minimum 3rd year of implementation. In some institutions, they're even in 4th year implementation. So another outcome was TCU requested the THET consortium to develop benchmarks from these generic templates, and I have now presented the 2 benchmarks approved by TCU and provided to other universities so they can benchmark these curricula. They all contain the 9 competency domains, and each university is supposed to adopt them by 80%, and the 20% is the flexibility of the training institution. This aim was also to use e-learning platforms to implement the curricula. The TED consortium managed to make sure that each institution has an e-learning management system, Moodle, in place, and it's functional. Students and faculty are continuously being oriented on the e-learning management, and on average 30 courses of the curriculum have to be on the e-learning, and assessments must be conducted and programmed. Here at MUHAS, this is already being implemented. I think in this year's academic year, many of the courses had the assessment online. In addition to this, we have developed 2 HIV online courses, and they are shared by the 3 institutions for MD and nursing courses. Our outputs, currently we have approximately 2,200 MD students using the new harmonized curriculum, 920 nursing students, and 30% of the courses on the Moodle platform either being taught or assessed. And we also have a decree from TCU that every other health profession institution must use the MD benchmarks to make their curricula. We also managed to get 3 publications for M1. The flagship is the curriculum development workshop. We also had opportunities and challenges that we saw, and we have experiences from the clinical and nursing faculty about implementing the curricula. Lessons learned. Key to the successful TET project was that top management in every university was committed. And the other thing that we learned, that curricula that are acceptable and they're feasible and adaptable is curricula that are made interprofessionally. We made these curricula where teams of nurses and doctors sat together to make the curricula. And this created more room for interprofessional education and practical opportunity. But the other thing we learned is that faculty need to be reminded to visit the curricula. When you go back to the universities and ask them, are you using the new curricula? You always find out which is the new curricula. So we need to constantly remind them that they need to know the new curricula and change the mindset and stop their traditional ways of implementing the curricula. And students are the key. They must understand the curriculum. The curriculum is not a book that must be hidden. Students must have access to it so they know what is expected for them and so they can prepare appropriately. And the last but most important is the need of faculty development units are necessary to support faculty to use novel-centered pedagogical and assessment method for success. Thank you for your attention.
So thank you very much, Professor Doreen. So So we think maybe we are going to hear first all the three presentations, and then afterwards we'll have time for questions and answers. So if you have any comments, please jot it down. We'll have time where you can pose your questions or maybe give your few inputs to the presenters. So the second presenter is Professor Emmanuel Balandia, who is going to talk on the community of young research peers.
Thank you very much, George, distinguished guests, ladies and gentlemen, good afternoon. I'll be happy to take you through experiences with the community of young research peers, which was part of the THET project. I'm presenting this on behalf of Professor Liamuya, who was overall head for entire AM2. So this will be a repetition, why we have THET. The major goal is to transform educational environment for doctors and nurses primarily, but we invented and tried to be inclusive of other professions as well. There are three aims: competence-based education, Professor Mloka has presented. We belong here in number 2, supportive academic environment for education and research. Specifically, aim 2.2, building community of young research peers. So what is the genesis of this? There are two aspects of this. Number one is that research mentorship is lagging behind. Professionals who are trained to be academicians usually are required to do advanced degrees. If you want to do mother and reproductive health, you have to do obs-gyn and so on and so forth. But there's very little emphasis. Although research is a major, what I can say, core business for academic institutions, there's little emphasis on research mentorship. So that's number one. And therefore, everybody is trying to do their own models of how to inculcate mentorship in research. But the existing models have problems. For instance, they are primarily vertical. They are focus on single rank of trainees, usually either undergraduate or postgraduate alone. Usually one institution is doing this, and then you have limited multidisciplinary approach. As we've seen, the way we've emphasized on curricula, we did the same emphasis on research mentorship, the multidisciplinarity. Why do we think that this is key? It's because of the nature of health problems, which are very, very complex. We had the experience of COVID, and we know how multidisciplinary cross-institutional collaboration was necessary. So in order to groom the next generation of investigators who are responsive to the need to collaborate, I think we thought it's necessary to design the community in a way that it's addressing all of those challenges. And therefore, the aim or the main objective was to provide a mentorship program for young faculty in Tanzania in health sciences, and make sure whatever system we are devising is really interprofessional and cross-institutional, and to offer a platform where young peers in a mentored environment can dialogue research challenges, can share experiences and ideas, assess funding opportunities, and critique their own proposals and manuscripts. So this is a roadmap we had for 5 years of implementation. We created the first core group in year 1, senior leaders who are mentors, and then the young peers themselves in the first cohort. And then we embarked into mentor research awards. We provided about 10,000 USD to each one of these trainees in 2 phases, 5,000 each. We focused on research training, and then secondary data analysis, and then education research were some of the core themes. In year 3, we continued with all of this, but we emphasized more on presenting their work, registering into PhD, and then publishing, and then applying for grants. In year 4, we were able to recruit another group of 12 peers for a total of 24. And then in year 5, we continued mentoring the second cohort through the same themes. So the community comprised young faculty most importantly, but senior leaders or senior scientists. And then we co-opted fellows from KUHAS who were part of the previous funding by NIH called MEPJF. So we co-opted them to provide, if you will, some initial mentorship to the young group. So this is a group of senior leaders that started this. Guest of honor, we unfortunately lost the first two through the course of 5 years. With your permission, I request maybe we stand for 1 minute to remember them. May our Lord rest their souls in eternal peace. And together with Dr. Gunda and Professor Mteta, we had Professor Bruno Kidenya who is here, Professor Mbaga, myself, John Bartlett from Duke, and then Professor Eligus Liamuya. So the first cohort of young peers comprised of 4 junior faculty from each of the 3 institutions as listed here. As you can see, they were predominantly nurses and MD, but we tried as much as we could to include other professions as well. So in the first group, we were able to sandwich 2 from public health. This is a bioethicist, and this one is a public health specialist. In the second group, we tried again to do almost the same. We included 1 colleague who is a library expert, and then 1 from traditional medicine and public health. So that comprised the 24 group of young peers. I'm glad to see most of them are here. Good to see them presented here today. These were the MEPJF fellows who were very instrumental, especially in the beginning, to give some sort of footing for the new fellows on how to live in a community. And then not forgetting the supporting staff from MUHAS, KUHAS, KSMCO, who were instrumental in making sure our processes were very, very well coordinated. So what were we able to achieve? In the first cohort, we created a group. We were able to hold meetings, physical meeting at least once every year. And we were doing this rotationally. So we have meeting here at MUHAS, and then we'll go to Moshi or to Mwanza, and then rotate like that. We were able to give research trainings, mentorship workshop. The scientific meetings via video conferences were the highlight of the mentorship. We planned to have a meeting every 2 weeks, but we ended up doing every week because of the demand and the response. So it went really, really well. We were able to disburse the mental research projects and conducted data analysis, secondary data analysis workshops. And we wanted the first group to be trainer of trainers, to be very well grounded so that they can give the mentorship to the subsequent cohort of young peers. We, again, in the second cohort, were able to make sure they went through research training and attend the video conference sessions, which were now left to a great extent in the hands of the first cohort as part of the mentorship process. We joined the 2 groups so that the video conferences as well as physical meetings were joined. And we made sure we focused on writing and submitting manuscripts, as I will show you in the subsequent slides. So what are the outputs? The first one is we were able to mentor 24 young peers, but they were also able to mentor others, notably 67 undergraduate students. So this was what we call vertical kind of mentorship. We as seniors are mentoring the young peers, and then they are also mentoring students. But we fostered what we call horizontal mentorship through peer-to-peer mentoring within the peers themselves. The young peers were trained to carry out research through data analysis workshop. But specifically, I want to single out Professor Kidenya. Since joining the consortium, he's very instrumental in making sure starter sessions were conducted on a weekly basis through video conferences. So all our peers are very well grounded in statistical analysis. As we speak today, 15 of the 24 are already enrolled into PhD, and 1 has graduated. This is another thing that we are really proud of. Peers were responsive to the need of writing research grants themselves. And a lot of funding has happened. Professor Blandina, I think you have several peers that already have funding through Pfizer and other grants. Here at MUHAS, one fellow obtained NIH awards, actually, 2 NIH awards, and so on and so forth. During COVID, many, many fellows were funded by the Ministry of Health to do research in COVID. In terms of scientific presentations, we've had many. I'm just presenting the one that I'm sure of. Over 12 scientific presentations by peers. But we have, I think one of the highlights is publications. The peers did very, very well in scientific publications. To date, we have 20 publications in international peer-reviewed journals. 18 of those are by peers themselves, but us as senior leaders, we published 2 papers. And there are a number of papers that are in the pipeline. Both senior leaders and peers advanced in the academic ladder. So we had several promotions from all the institutions, from MUHAS, KUHAS, and KMC-MUKO, as seen here. Some of the young peers here, like Dr. Alex, Honest, are now senior lecturers, and Mariam at MUHAS, and the rest of us are senior leaders. So these are the 2 publications that as senior leaders were able to put, describing the mentorship approach that we undertook and trying to share the experiences for the benefit of other institutions that may need to go into this direction. And for the peers, these are the papers that they published. Very good papers in international peer-reviewed journals covering wide spectrum of health challenges in the HIV population. So I will just go through them quickly. This is another set, and then here. And then the other papers there. This is one of the highlights for me in terms of publication from young peers. This was a paper by peers explaining their experiences with the mentorship. So this was very good to see peers coming together and having a reflection beyond their research projects. This, I'm sure that you didn't expect me to show this, but I'm showing it anyway. So these are young peers in one of their outings discussing, I don't know what they were discussing. The legend has it, there was an artist nearby who decided to draw them, and this is a cartoon that he came up with of this meeting. So we can decide who is correctly depicted. I don't know. Maybe Baraka looks. I'm not sure about others, but it's a memento that we keep for memories of the community. So what have we learned? Building a research mentorship capacity is a good model for both dual and horizontal research mentorship of young investigators. And to be able to sustain it, we need to have all those components. Making sure research training is there, there's good coordination and management, and then scientific writing and communication is enhanced. Collaboration, communication, and sharing of experiences is critical, and interprofessional and cross-institutional collaboration was also very key. The team is now collaborating beyond research. As I'm saying, some of the peers are already external examiners, for instance, in sister institutions. So the scope of collaboration has grown far beyond what we anticipated. So our reflections, you need all these ingredients for a successful community. You need to make sure there's a good composition of senior leaders mentoring young people, but also students are part of that for sustainability. And making sure you have all those ingredients, meaning enabling environment, collaborations, career development track, research funding, and here I mean at least seed funding for young peers to brew their research projects before they can solicit bigger funding from external sources. So we are recommending 4 things at least: to formalize the research mentorship project model, to expand this, what we call the joint research mentoring model, to promote and strengthen research collaborations and establish resources for research funding. This is sort of the ideas we think that this can be implemented. For formalization, as I said earlier, we lack formal mentorship for research in higher learning institutions. So if this is put forward as a requirement for every junior who's joining academic ranks to go through, I think it will go far in terms of accomplishing the long-term goals. So institutions are encouraged to establish guidelines on research mentorship. Also include the element of protected time for research. I know there's a lot of competing interest for training, but maybe some protection, at least for junior faculty who are growing. To expand the team of seniors who are interested in providing this mentorship and enroll young people. We need also to expand the community beyond the 3 institutions to include all the health sciences universities in Tanzania. We also need to embrace the spirit of multidisciplinary interprofessional collaborations as already elaborated. The issue of resources is critical. I think this is something that institutions need to discuss. They need to start allocating internal generative funding to support research by young professionals at health institutions. I know this is happening at least for some of the institutions. So in conclusion, the CRP planned the activities were conducted very well. The collaborating spirit and mentorship was very instrumental, and we strongly recommend this for sustainability for the future. So I want to thank you, everyone. Thanks everybody who took part in the community. Thanks very much.
Thank you very much, Professor Emmanuel Balandia. I wanted to ask who did the slides. Is it the young peers as well? Okay, so the last presenter for today is Professor Maiden Moshi, who will talk on the communication and outreach, and perhaps tell us a little bit about the system that they have developed. Welcome.
Yeah, thank you very much. This was the third and the last aim of the project. To implement activities of the third project, it was necessary to involve stakeholders in government, academia, employers, the public, professional associations, students, graduates, and to do this, we did this in order to enhance clear and efficient communication among the stakeholders, so that we could effectively involve them in giving inputs for the development of the curriculums. We use the media a lot, different types of media, the news media, but we also use things like the Twitter, YouTube, radio, TV, and newspapers. One, to sort out some of the misconceptions which emerged at the beginning of the process. You may remember some of the newspapers started talking about developing the same curriculum or standardized curriculum, which was not what we aimed at. The purpose, as has been explained, was to harmonize to develop a harmonized curricula with elements which would be common across all the institutions, and that's what has been referred to as the 80% component, and then you have the 20% component which would be specific to individual institutions. We also organize physical workshops. Most of you were, except the peers, I suppose, but they were represented under the flagship of students. We are represented in these meetings. But the second bit of this communication and outreach of the strategy of the project was to create a mechanism for reaching out to our graduates. And why reach out to our graduates? One, we want to establish a continuing communication, because as was conceived within the project is that once you are posted up country, once you are posted to regions, to the districts, there is no way of communicating to the training institutions, but not only that, professional councils and so on. So we thought to establish a sustainable way to reach out to graduates, and this way by implementing a graduate tracking system across the three collaborating institutions. That is KUHAS, KSMUCO, and MOHAS. So the dissemination of the project took off from the time of launching, in which all the stakeholders indicated they participated, including media, and media outlets played a big role in educating stakeholders on the difference between adopting a harmonized generic curriculum and adopting a standardized curriculum across all health higher learning institutions. The physical meetings were instrumental in involving all health higher learning institutions in Tanzania mainland and Zanzibar, and professional councils in the development of competences and ultimately the MD and BSN curricula. You may remember how we sat here with flip charts, different groups, sorting out the competencies, eventually until we agreed on the 9 competencies to include in the curricula. So the project web pages, our project web pages were created at each of the THET partner institutions, which posted and publicized project activities and events in addition to the physical meetings and the media. So every now and then when we had an activity of the project, this activity was posted on websites of each of the 3 collaborating institutions. What were the outputs rather than outcomes? I'm not a monitoring and evaluation person, so these terminologies, so these certainly outputs. The curriculum harmonization process was disseminated to special interest groups, including the TCU, professional councils, Inter-University Council of West Africa, the Minister of Health, Minister of Education, Science and Technology, academic staff, colleges, and universities through FUXT, the Public and All Health Higher Learning Institutions, and at an international conference which was hosted by the NIH in Mozambique. The harmonized generic templates of the MD and the nursing curricula were shared in a meeting with FUCS TCU and professional councils, and as explained by the first speaker, frameworks developed from the two generic templates of the MD and BSc nursing curricula were shared in a meeting with the TCU, which blazed the adoption as official frameworks for sharing with all health higher learning institutions. Capacity building for journalists, mainly the print, TV, and radio, on how to disseminate health-related information. This was another of the outputs, and the impact may not be felt immediately, but they were given a head start on which to build this area of journalism. This is an area which is not developed in this country. Journalists reporting professionally on health issues is not an area which is developed. I know we have one who is a medical doctor and an expert with a master's in this area, but we need to expand this area so that we have correct reporting, informed reporting, and this is what we kick-started, and we hope that the fire we lighted will not stop there, it will continue. And then we have involvement of stakeholders was a good investment, because having participated in the development of the harmonized generic MD and nursing curricula and their frameworks, some of these institutions have already adopted the frameworks and reviewed their curricula, and ownership of the frameworks by TCU has made it possible for KUHAS, KSMUCO, and my university, Kairuk University, MUHAS, Q, St. Francis Ifakara, some informed, Ruku, SUSA to review the MD and some BSc nursing curricula. So you can see the fire is already spreading if the information I have is correct. So the building blocks are already being laid on the house, and subject also bringing in the capacity for academic staff to teach. We are going to see a lot of improvement across all our health higher learning institutions. Number 4, the adoption of the frameworks addresses what at the launching of the THET project was cited as a problem, so it is a direct impact on the quality of our graduates, as the respective professional councils have a common yardstick on which to assess graduates across all the health higher learning institutions. I don't know how, or maybe this has not been fully implemented, so we are not yet to see the results, but come the end of 5 years for those who have started and beyond, we should be able to see some of these results being reflected on the performance of our graduates before and after doing the registration examination. And the outcome so far is that one publication has been made from this sub-M 3.1 published in the African Journal of Health Professions Education this year. And then on implementing the graduate tracking system, the aim was to reach out to graduates all year round through creation of a robust GTS or alumni portal at KUHAS, KSMUCO, and MUHAS, with functionalities for one-on-one and group chatting, sending batch messages by SMS, with a payment portal for paying the alumni subscriptions, and capability for posting job opportunities, trainings, workshops, information on employment updates, the whereabouts of graduates, meaning the workstations, and links for graduates to update their information. So it's two-way for the institutions to be able to post information, professional councils to post information, employers to post announcements, but also for graduates to be able to chat among themselves. And also to create capacity to collect graduates' data in different disciplines and their employment status. So, outcomes and sustainability at institutional level. Installation of a GTS at KUHAS, KSMUCO, and MUHAS has enabled them to put their graduates' data in one electronic platform to use for different purposes. This has been achieved, I believe, across all the three institutions. They have all their graduates in this database, subject to improvements that are ongoing to make this platform more powerful and more meaningful in terms of realizing some national benefits. So the three institutions are being capacitated with a seamless feature to transfer graduate records from student information management systems, whether SARIs or SIMS, to the GTS after graduation. So the mechanism is, this is automated. It's going to be automated where this process is not being completed. So once you graduate, the information will automatically be pushed or transferred to the GTS or alumni portal. At the national level, an API for end-to-end interface with TCU, the Loans Board, the Ministry of Health, and UTUMISHI to allow them to tap in and get information of their interests. For example, locating graduates who have not paid loans, some of the features that are currently being finalized. We had some hitches, particularly where we had to seek eager permission to do these systems. This has been part of breaks which have delayed this process, but otherwise very good progress has been made. So this feature is empowerment, particularly to TCU, which on linking with the GTS, they will automatically harvest graduate data from institutions. There is potential to create a one-stop shop for harvesting health human resource data for use in planning. This is something that is missing not only in the health higher learning institutions, but also other areas. So if we will be able to create one platform where people can access this information for planning purposes, this is certainly going to be quite some success, actually, with this regard. So there is potential for future expansion of the GTS for greater national needs. Potential to support the country in pandemic readiness, where it will enable the government to locate experts and deploy them in times of need, such as in disease outbreaks. This is one other ambition which is contemplated with the GTSO alumni portal, and this is ongoing. So what are the lessons learned? One, resistance to adapt new technologies should be addressed in order to realize the benefits of the GTS. there is a need to create a central pool consolidating institutional GTS data. But to be able to do this, certainly IGA has to play a big role here. I'm told there's something called eBus. If they would link all these institutional data to an eBus, then it's going to be possible to pull the data. It's going to be very useful for planning purposes. So buy-in and support by IGA will be important if the GTS benefits are going to be realized. As the THET project, we thank all the stakeholders for your undivided support throughout the 6 years of the project. Thank you very much.
Thank you, Professor Mainen. I know we were supposed to have a few rounds of question and answers, but I'm told that in the interest of time, we'll transition directly into the launching of THET Academy. When I was a student, whenever I was excused from responding to questions after giving a presentation, I always felt happy. So I don't know, should they be delighted or is it a missed opportunity for them? So leading us in the launching of the THET Academy, I would like to welcome the PI of the project, Professor Gideon Kwesigabo, for introduction of the THET Academy. Karibu.
Good afternoon, Your Excellency, the guest of honor. As you may have heard right from the beginning in the morning, there has been an effort all the way through to enhance the quality of faculty in terms of teaching, learning, assessments, and all those skills and competencies. And therefore, in order to sustain and move forward these activities that have been accomplished within that particular aim of faculty excellence, we are proposing that a THET Academy, which is the Tanzania Health Educators Academy, is launched to carry forward the work that has been started by the project, so that at the end of the day, it is now owned by all faculty educators across the country. And therefore, before I move on, or maybe before we invite the guest of honor to launch this particular THET Academy, which is some kind of an association that will be run by ourselves to enhance the quality of training, may I now invite Professor Stephen Mshana to come and tell us what has been prepared as regards the Constitution, the requirements, and all those issues that entail an association, or if not an association, the way you'd like to call it when you meet for the first time during the annual meeting, so that these, what will be presented, can now be discussed or form the basis of the discussion, so that this particular association can move forward and ensure the sustainability of teaching and learning and faculty excellence continues. Professor Mshana, please.
Thank you, Professor Kwesigabo. My task is to take you through the constitution which the founders of this academy have prepared, so that we can sustain the activities which THET has started. So the rationale which came from why we need this academy, the health educators
they are conscious of the importance of attaining the highest standards of health professional education. So these are the founders. They are conscious of this. But they are also convinced of the need to ensure that the training of health professionals in Tanzania is strengthened to ensure the teaching skills of our faculty are enhanced to promote equality of learning and learning outcomes for our health professional students. But also these educators who are the founders, they are desirous of establishing Tanzania Health Educator Academy to oversee and coordinate the training of health professional educators in the various health profession schools and set a standard for the faculty development. So this is the rationale why we need this academy. So the Constitution has 10 parts, but in part 1, it's really, this is a voluntary organization, but it has a vision to raise the quality of health professional education by promoting excellence in teaching, research, mentoring of faculty and tutors. But the mission is to create a community of health professional educators that promote and recognize the need for education excellence in health professional training. So this is the vision and the mission of the academy. So with the claps after the introduction, it seems we are all ready to ensure we achieve this vision and mission of this academy. So the part 2 of the Constitution is that is the establishment of the academy, an academy to be known as Tanzania Health Educators Academy, hereafter referred to the academy. And the purpose of academy, as I said, in line with the vision and the mission, is to promote and advance health professional education through research, training, and collaboration among medical professionals and education institutions, to provide a platform for enhancing ideas, knowledge, and best practices in medical education. So this is the purpose of the academy. So the objective of the academy, there are 8 objectives of the academy. 1 is to promote excellence in planning and designing learning. 2 is encourage excellence in facilitate learning. 3, promote faculty education development. 4, promote validity and reliability in the assessment of learning. 5, encourage and value education research and scholarship. 6, support education leadership. 7, recognize education excellence. And 8, encourage innovation and the constant improvement of education methods in Tanzania. So the membership of the academy, the eligibility. So the membership in the academy shall be open to individual and institution involved in medical education, including but not limited to medical educator, researchers, practitioners, and students. A member shall be anyone actively involved in educating health professional students who cares about improving professional practice and developing skills as health professional educator. So these are the eligibility of the membership. So the qualification that requires somebody to be a member. Membership category shall vary, so we have different membership categories, as they will present later, but according to the level of experience and the record of achievement in educational domains. So we have 6 educational domains in our constitution. The first one is teaching, activity, curriculum and assessment development, advising and mentoring, educational leadership and administration, educational research and scholarship, innovation in teaching techniques. So you'll find based on the category of membership, there are some which require to have multiple of these domains to be at that particular category of the academy. So the membership rights, they have right to participate in all activities and events organized by the academy. That's their right. To vote in election, propose amendment to the Constitution and hold office. And their responsibilities. So if you have right, you also need to have responsibilities. So responsibility is upholding the value and the objective of the academy, actively participating in its activities, and paying any required membership fees. So these are some of the rights and responsibilities. So the membership category. The first is student membership. So this is undergraduate and postgraduate student, either new to teaching or interested in pursuing a career in teaching and educational scholarship. So this is student membership. Associate member, interest in membership with a professional commitment to core values and an understanding of the key responsibility of health professional educator. This is the associate member. And then we have member. So a member should be able to demonstrate the following core competencies. Use a basic range of educational method and technology to achieve intended learning outcomes. Develop as appropriate learning resources for planned courses or activities. Demonstrate ability to contribute to the process or system at the institution level that support individual and or groups undertaking educational and research activities. Then demonstrate the ability to continue to faculty development of learning and teaching principles with impact within the institution. And then to contribute to projects involving scholarly or educational research activity within the institution. So this is some of the attributes for a member. And then we have a fellow. A fellow member category, this should have significant commitment and achievement in health professional education matter, within significant as the health professional educator, and be a leader in his or her field, and must have helped to shape strategy and the policy around health professional education. So this is one of the quality of a fellow. And he should be able to demonstrate, contribute to the process or system at an institution or broader level that support individual and or groups undertaking educational and research activities. And it also should demonstrate the strategy application of learning and teaching principles with an impact that extends beyond the institution. So from the member, this now the fellow is going beyond the institution. Also should contribute to organization strategy which ensure that the teaching and learning are optimally accessible and inclusive to all learners at the institution, and also to contribute to scholarly or education research project within the institution and outside the institution. And then we have a principal fellow. This is an individual who have demonstrated significant strategic leadership within and across systems and may have a national or international profile, and should be able to demonstrate the following core competence. Leads the development and implementation of assessment strategy at the national level. Ability to lead the enhancement of cross-cutting innovative education program and curricula. And leads the organization strategy which ensure that teaching and learning are optimally accessible and inclusive to all learners across multiple institutions. But also should lead projects that involving scholarly or educational research as the THET project should be lead this type of project. So these are the quality of a principal fellow. So the Constitution also taking on how to apply. So the application require personal statement and CV and or record. So there are some of, for example, student membership just need a personal statement and CV, but for other you may need a record of achievement in one or two or multiple education domains, as those 6 domains, depending on the category. And the part 6 of the Constitution discuss about procedure for membership. So you have to submit updated CV, personal statement with evidence of achievement of educational domains, which will be reviewed so that you can be categorized to the particular membership category you're applying for. So the benefit of being a member, recognition and reward. So the academy will be recognized and reward outstanding health professional educators annually for their outstanding contribution to the education, clinical, and research missions. But member will have access to a network of medical educators at every level of their career progression. So these are some of the benefits of the member. So the governance of this academy. So legislative organ of the academy is all active member eligible for voting during the general meeting. So this is the legislative organ of the academy. But the academy will have the executive committee. So the executive committee shall be responsible for the overall management and administration of the academy on a daily basis. The committee shall consist of 13 members elected from among the active members of the academy, and one which shall be elected as the president of the academy. And the elected officers of the academy will be vice president, the secretary, and the treasurer. The other governance regarding meeting, there will be a general meeting. The general meeting shall be held at least once a year. This meeting shall provide a forum for members to discuss matters related to medical education, present research findings, and share best practice. Executive committee meeting, the EC shall meet regularly to discuss and plan the activity of the academy. And the quorum of those meetings shall be at least 1/3 of the members who are eligible to vote. Amendment of the Constitution. So proposal for amendment, as I talked on the right, any member of the academy may propose the amendment to this Constitution, and the approval of the amendment shall be approved by 2/3 of majority vote of the member at the general meeting or through online voting system. So these are some of the parts of the Constitution. As clearly stated by Professor Kosigabo, the aim is to take all the activities which THET has been doing. So with this, the acknowledgement to the THET project and the funder and the founding members of Tanzania Health Educators Academy. I submit.
Thank you once again, Professor Mshana. And I would now like to kindly ask the high table to please come to the stage as we go into the now official launch of the THET Academy. Okay. So now it is my pleasure to call Professor Gideon Kusigabo, once again, who is the PI, to welcome the Director of Higher Education, Professor Msofe, for the official launch of the Academy.
Thank you very much. I will also request the high table to all stand up. Thank you. And we will bring, those are the constitution. We have wrapped it in a bow, and we'll ask the guest of honor to just cut the ribbons, and that will symbolize the opening of the launching of the THET Academy. That is the constitution of the THET Academy. Naomba usogee mbele. No, yeah. Sorry. Thank you very much. And Professor Kwesigabo, please, you can give one constitution, those ones, the ones, you can give one constitution to the guest of honor, the second one to the director of, from the Ministry of Health. Yes, you can give to all the high table, one for each. Thank you. And we can have, before you sit, you can have a, yes, holding your constitution, we can have a picture of that. Asanteni sana, naomba tukae. We will also distribute this constitution to each and every person who is around here. We'll get one copy of the constitution. Thank you.
Yeah, so thank you very much. After the launch of the THET Academy, as we heard clearly in the morning and as we have seen the presentations, this has been a 6 years project since its inception in September 2018 up to date, the 26th of August 2024. So it has not been without the efforts of many people and institutions. So we wish to give some token of thanks and appreciation to the people who have led and have supported this to happen. So shortly, I will request the high table to lead this exercise of recognizing individuals and institutions who have really supported these efforts to have reached so far. We will start with individual recognitions, and I have the singular honor to read what has been written before I hand it for the guest of honor to give to this very person I will mention last. So our deepest appreciation too, in recognition of exemplary leadership and commitment to the THET project, which has been awarded this date of 26 August 2024 in the Transforming Healthy Professional Education Grand Symposium to Professor Gideon Kwesigabo. In recognition of visionary initiative, exceptional dedication, and commitment in shaping health education in Tanzania, which has been awarded to this date of 26 August 2024 during the Transforming Health Professional Education Grand Symposium, our deepest appreciation to Efata Kaya. So we request on behalf Professor Levina Msuya, on behalf of KESI. we wish to recognize the Best CYRP Award in recognition of outstanding performance in the community of young research peers, which is awarded this 26th day of August 2024 during the Transforming Health Profession Education Grand Symposium to Dr. Alexi Mremi. Yes, you start here. In the very first session, we had the opportunity to see and hear on behalf of Professor Efata Elkanakaya, a voice of Professor Doreen. Should I mention the other names? Mainen, Anna Sophia, Julius, Gerard, Desamburo, Mloka. For the outstanding performance as the AIM lead who published most of the product of the THET professional consortium. So Dr. Dorini Mloka. Please bring the award for Dr. Dorini Mloka to the podium. So, yeah, thank you very much. Dr. Dorini Mloka, Professor Dorini Mloka. Bring the institutional awards, please. As stated earlier, this was a consortium of 5 universities, and the prime institution was MUHAS. So this is presented to Muhimbili University of Health and Allied Sciences, MUHAS, in sincere appreciation for outstanding commitment to the success of transforming health profession education during the 26th of August 2024 Transforming Health Profession Education Grand Symposium. So the Vice Chancellor, in this case, will be presented by the Deputy Vice Chancellor Academics, Professor Emmanuel Balandia. This is presented to Catholic University of Health and Allied Sciences, CUHAS, in sincere appreciation for outstanding commitment to the success of transforming health profession education during this Transforming Health Profession Education Grand Symposium, which will be given to the Vice Chancellor for CUHAS, Professor Kamugisha. This is presented to Kilimanjaro Christian Medical University College, KCMUCO, In sincere appreciation for an outstanding commitment to the success of transforming health profession education during this 26th day of August 2024 in Transforming Health Profession Education Grand Symposium. On behalf of the institution, Professor Levina Msuya, as it was stated, this was a consortium of 5 institutions with 2 institutions from the US. This is presented to University of California, San Francisco in sincere appreciation for an outstanding commitment to the success of the transforming health profession education in this 26th day, August 2024, during the Transforming Health Profession Education Grand Symposium. It is not that we are outsourcing you. Dr. Ahazi, on behalf, please receive this award. This is presented to Duke University in sincere appreciation for an outstanding commitment to the success of transforming health profession education this 26th day of August 2024, Transforming Health Profession Education Grand Symposium. We are not outsourcing you, but Dr. Rosie Leiser. Tunampa nani? Tumwete nani aipokea TCU? Sawa. It is with the commitment of the government that what we have discussed and presented today will be sustained. This is presented to the Tanzania Commission for Universities, who were part and parcel of the development of the curricula benchmarks. It's not that we are outsourcing you, but Professor Mshana, on behalf of TCU, we request you to take this award. With all protocols observed, we are in Ministry of Education, but our product is serving the Ministry of Health. In sincere appreciation of the Ministry of Health for an outstanding support to the success of the Transforming Health Profession Education, this is presented to the Ministry of Health, and now the protocol will change a bit, because this will be received by Dr. Leiser, but not the very first one. With the good words and commitment of the Ministry of Education, Science and Technology, And from where we started to date, hoping that the future is more bright, this is presented to the Ministry of Education in sincere appreciation for the support to the THET project and the product beyond the project. So now I'll request Dr. Leiza, the Director for Human Resource Development, Ministry of Health, to hand this to the Director for Higher Education, Professor Peter Msofe. With this short, long exercise, I wish to thank the high table and all of you for supporting, constantly clapping the very same volume and tune. And may I now welcome you for the lunch.
Kwa wale ambao wamepata zawadi, kuna packaging boxes outside, so please you may go outside and they may package your gift. They may wrap your gift in a package for easier carry. So all those that have received awards, there is a special packaging outside that will allow you to carry it more conveniently. Na karibuni kwa ajili ya lunch.
Good afternoon. Welcome back after the lunch session. We are now going for a round table discussion. I wish to call forward Professor Johanna Mashala, the Vice Chancellor from Hubert Kairuki Memorial University, who will be the moderator for this session. And together with him, I wish to call to the podium the following. Dr. Pemba Senga, Professor Pemba, sorry. Dr. Haruna Dika, Professor Blandina Mbaga. Yes, I have these three people. So our discussion, I think, will not be very long. And it will start with the discussion from these three key people. And later on, some questioning and answers from the podium, taking into account the three presentations which were presented before the lunchtime. Professor Mashala, karibu.
Good afternoon. I understand that the voice is low, and remember I'm a physiologist. Yeah. Postprandial. Okay. Good afternoon. Okay, welcome to this panel discussion, and we have some the participants here, which I will request them to again reintroduce themselves, starting from my right-hand side, please. Just state your name and from which institution you are from.
Okay, I'm Blandina Teofili Mbaga from Kilimanjaro Christian Medical University College.
Thank you very much.
Good afternoon. I'm Senga Pemba from Santa Francis University College of Health and Allied Sciences in Ifakara.
Good afternoon. My name is Dr. Haruna Dika from Catholic University of Health and Allied Sciences.
Let's put our hands together for the panelists. Let me start by asking my colleague on my left-hand side. Higher learning institutions in this country are facing one of the challenge of trained academic or competent academic staff. Most of higher education learning institutions do face this challenge of academic staff. Now, how can we capitalize on the adaptation of harmonized curriculum to address this challenge? Please, Karibu. Professor Senga.
Thank you, Mr. Moderator. Let me start this way. Shortage of academic staff hinders job performance. And that means the teachers won't cover the curriculum. But secondly, it creates stress on teachers, on academicians, with a heavy workload. But the consequence is that it leads to poor academic performance from the students. At the end, you have an incompetent health workforce. So it's an issue which we need to address. So the question here now is adapting the competence-based curriculum a solution to mitigate this kind of challenges? To me, the answer is yes. Why is it so? In competence-based curricula, actually teachers are just facilitators of the learning process. The learning is what we call student-centered approach. Now, let's go back to our curriculum, to the CBC curriculum, which was developed by THET. If you look at the content is core, okay? Although I would have wished, Mr. Moderator, to have an aspect of what we call options or special study modules, which would allow for what we call nowadays multiple intelligences, but it's missing this curriculum. Actually, I wanted to raise that issue when some people were presenting here. But the core content does help teachers or academic staff to teach without stress. Why? Because the content is important, it is standardized. Imagine if this curriculum was what we call a subject-centered curriculum, where every teacher would come with your own subject. You would be having thousands of academicians there teaching. But because we have core curriculum, we are only recruiting teachers who are teaching important contents. Of course, you might argue that every content is important, but at the end of the story, we are looking at competencies. We are looking at learning outcomes which can enable somebody to perform a professional role. So on that basis, yes, we don't need so many teachers because we have a core curriculum which alludes to fewer teachers. But secondly, if you look at the teaching methods in this curriculum, we have independent studies. We don't make use of them, where students could be assigned specific tasks, problems, they could go and search knowledge on their own. So you don't need to struggle with these students. You just assign them and assign somebody to supervise them, okay? We have assignments, which are actually even more suited because they control even students' behaviors. So we give them assignments. You don't have to spend a whole day teaching or invite somebody to teach. You just say, we are giving you 3 days to do this assignment. So the teaching methods in this curricula allow for few teachers other than just, recruiting everybody to teach. Okay? But let's go to the students themselves. With competence-based curricula, you can organize students very easily into groups, so that you can conduct tutorials, but also even leave them to what we call peer tutoring. They can teach it themselves. They can even assess themselves, peer assessment. So you don't have to have a teacher doing all this. Of course, you could assign somebody even to co-teach, okay? Yes, we could go to other areas where we think this is a solution. The learning outcomes in this curriculum are well specified. So if a school is organized with these learning outcomes, you can have actually what we call interprofessional, multi-professional approaches, You don't have to recruit your own teachers. You can have somebody delivering a lecture, because nowadays there is technology. He covers all these subjects without any struggle. So to me, this is what I think. However, we need to be cautious. There are factors which you need to consider. General factors, for instance. Are the learning outcomes delivered from leading needs? That's a question. But there are student factors. How many students are we recruiting? Okay? That's a question. There are teacher factors. Do the teachers have the right skills, or even right skill mix? Okay? And organizational factors. The learning environment, is it conducive? Okay? So we need to take into consideration these aspects. Mr. Moderator, and submit. Thank you.
Thank you very much, Professor Senga, for looking into this area. Literally, you are saying you agree that this harmonized curriculum, in fact, will alleviate the challenge of shortage of staff in many ways, because the emphasis is a student-centered learning, and teachers are there to facilitate the process. And if this is adapted, then consequently we are saying the staff will have sufficient time to focus on preparation for their teaching materials, and also they'll have less stress. And you're also saying if they have more time, most likely they devote the rest of the time for doing other things, isn't it? Thank you very much. Now, let me go to the next one. And unfortunately, Muganyizi is not here, Professor Muganyizi. I wanted to link this one, what Professor Senga just said, with the issue of learning management systems. We have the learning management, systems, platform, Moodle, etc. Okay. Now the question which I would like to pose is, having these systems, or how can an institution use these systems to cross-training as a way of mitigating the pressing shortage of staff? Any one of you would like to talk about it?
Yeah, maybe I can just mention. Yeah, thank you very much, Chairperson. Yes, using the learning management system, this learning platform, it can be helpful because there are some of specialization which might be missed in one of the university, but they are available in another university, and it might be the challenge also to make one person with a professional, which is quite demanded in other institutions, go around all the institutions and teaching. But if this person will record the teaching and will share the material through the Moodle, That means all of the university at the country will receive the similar messages, similar training, as well as doing the same exercise, for their competence and other things. And this examination also could become uniform from one person, but we expect that this person will also teach others, so in other institutions, through the linkage, not only be like someone has produced material and all the universities are using this material years going forward. We expect that a mentorship and succession will go on in hands with the learning management system, that the junior faculty will also be taught and will learn so that they can take over within the universities, but still they can share skills and materials, because we know and we agree that we do have scarcity of teachers and lecturers in our universities, and we need to agree that we have to share some of these materials for teaching. And also by using the same system with the challenges like outbreak, we saw a very good example during COVID-19 that most of our universities, we were to train students through online training and using these different platforms. So if we have already the bank of materials and platform, it's quite easy to be used and shared in most institutions in case of when a challenge is, and still students will get the same and similar messages as we think about having the same products of trainees in our universities.
Thank you very much, Professor Blandina Mbaga. So in other words, she's saying, actually, these learning platforms makes it easier for people to prepare the learning materials, upload them, and they can be shared by different staff and make them accessible to the larger population of our students. Now, I think that's a very good approach. But will there be an issue of, what I may say, it's my material, the IP, intellectual property, it is produced from my university. Why should then, KUHAS, for that matter, use my material? What modalities would you think we should adopt in order to make sure that we don't, step on other people's toe? Dika, can you comment on that?
Not real. Yeah, maybe I'm not in position to talk about it. Yeah.
Professor Singh.
Yes. Let me give my own example. I'm developing a course in what we call remote consulting in healthcare, using Moodle as a learning platform. So the issue now is, won't this course be adopted by everyone? So the issue of intellectual property here comes on. So what we are doing now is, of course, to start preparing a kind of a protocol on intellectual property for this particular product. So yes, we need to be careful, otherwise everybody will claim that I'm the master of this program. Yeah, that's what I can contribute. But to add to what Professor said here, these learning platforms actually is a kind of what we call self-directed learning, because they're online. Students can access them wherever they are without the need to have a facilitator on face-to-face approach.
Thank you very much. So I thought I should raise this because you prepare the materials and then you upload them. Somebody accesses it and then you ask yourself, actually, some might even claim, this is my material, when in fact, the brain behind it comes from another institution. So I think this is a food for thought for THET. The academy we have established. We needed to look into these factors. How are we going to assure that we utilize these learning platforms, make them accessible so that a wider community of our students can have access to it, so that learning becomes not institutional, but is for the entire country. If there are costs, I think this is an issue which, again, you know, this academy should seriously look into, see how best these costs can be addressed. Now, the third question I would like also to ask is, most of us who are here, we are doctors, we are nurses, we are teaching, we are pharmacists, we are teaching our students based on our professions. But I think it's not uncommon to find most of us who have never been trained as educationists. Now, learning from the experience of THET project, how can institutions actually work together to address this challenge? Now, I think this is what I'll give to Dika. Yes, please.
Thank you, the moderator. I think from the keynote speech which was given in the morning, which highlighted the advantages of competence-based medical education. I'm not undermining the traditional way of teaching, but just now focused on competence medical education due to its objectivity nature on the methods of training and on assessment. I think CBC is the way to go. Being the way to go, it requires to have competence-based curriculum, and then follows its implementation. The success of implementation of the curriculum requires the full cooperation of the implementers, who are the faculty. So I think the first thing to ensure that the CBC is having reaching the intended objectives is to make the faculty full aware of the CBC, what is CBC itself, different it from the traditional curricula. So I think for our institutions, there's a need to create awareness to our faculty so that they know exactly the difference between the traditional way of facilitating learning and assessment and the facilitating learning and the assessment in the competency-based medical education. Having that, it also requires the training of these faculty, who most of them are not trained on how to teach and assess. So I think we needed to encourage our staff to voluntarily get trained on the teaching methodologies and the way of assessing our students. I think for the 3 institutions which were in the THET consortium, this is being done, although I'm not sure the extent in which it has been carried from each institution. But even for other institutions which were not in the THET consortium, I think there's a need to train our faculty on how to teach. This may not be necessarily a full course of the teaching methodology, but at least having short courses or maybe a series of modules of workshops to cover the maybe fundamental modules of the teaching and the methodology. It was said during the keynote speech that also there's usually a reluctance to change. So that's also another issue which we need to be aware. So as we're encouraging our faculty to get trained on the teaching methodology, I think each institution should have a mechanism of ensuring that the faculty participate in this so that they get trained. How? Maybe in terms of maybe motivating for the staff who are doing this, or even reminding for those who are reluctant. You know, it depends. So there may be a check and balance, because one way, for example, if by putting regulations, you may make some individual to get registered for the training methodologies, but they may not concentrate on that. So maybe important thing is that to to make individuals to get trained voluntarily, so that they know the importance of getting trained on the teaching methodology and the way of assessment. Which this is important even if we say, for example, set regulations, there's a need of follow-up to assess the practice of the faculty who have been trained on the teaching methodology. And also, so that we ensure that what has been trained can be practiced. Thank you, Madam, that's for sure.
Thank you, Dr. Dika, for that iteration on this area that actually, yes, indeed, we are not, majority of us are not trained as educationists, but you are saying as far as this competence-based curriculum is concerned, we need to raise awareness amongst the staff, and then we need to train them. And now, from raising awareness and the training and then implementing, I still have a question which I would like maybe some clarification now is what should be the focus? Is the focus on we, the teachers, or we would wish also to use, because earlier on we said in this competence-based curriculum, teachers become facilitators, isn't it? Now, is it possible that we may use other cadres that we have to facilitate some of the sessions? Anybody who can comment on this?
Yeah, thank you very much. Yeah, actually, it depends, because some of the people might not have been got education training like specific, but they are quite very nice in catching and facilitating things like this, because there are some of the things which come with interest and ambitions and gain skills. They should also be incorporated, because we should have been looking even in our university and see some of the people and maybe capture them earlier so that they can be part of this. So for me, I think that now, as we have done this training, especially of HPEG and CPEG, I think it should be something which keeps on continue within the universities, so that this group of people who are trained, it could be a habit of the university to make them at least once or twice a year have continuous kind of training, refresher to those who have been training, but always adding new members and new faculties, so that each faculty at the university could feel that they are part and parcel of the teaching methodology, of the curriculum development training, and others, so that we could have many peer educators, and even those who are in clinical field, they should not feel that they are left behind, because they can still participate and work into it. When you look at our HPEG and CPEG here, most of them are in clinical fields, also basic science and others. So always you should have somewhere to start, yeah? And those people you start should be catalysts, should be mentors, and continue to trickle down this, but the university should take also as a habit, at least once or twice a year in their budget, that there is this training, refreshers, but also new members are always taken in, so that they can be able to be trained and supporting to this. I loved the idea today of THET launching, yeah? Because THET launching, I could look, has a vision also of like taking what we have started through THET forward, not to end with the training which has been done, the research, as well as the academia, which has been already developed, a very nice and basis. It should go forward, yeah, so that it can continue to be sustained within the country, and I believe most of people will become educators, and they will support, because the system, the competence-based system which we are adapting, and taking into account that it will be taken over all of the university, that means we still need more educators to support our own institution, but to support also new institutions who will take up the curriculum and keep supporting them. And this is the only way we can go, not like project is closed, we are closing this. It should be the start today.
Thank you very much. I'll give you, time later on, but let's proceed. Now, all our institutions of higher learning, education in all over the world have mainly three institutional objectives. They teach, they research, and they do community engagement. Now, I have a question here. The quality of research outputs require skilled, competent researchers. I think we all agree. Now, with the dwindling resources in our training institutions, how can we optimize on THET experience to strengthen research skills of the junior researchers in these institutions? Prof.
Thank you very much, Prof. Mashar. Yeah, actually, it's almost like the last point I finished, that THET has created a background. THET has created a community of young research peers who have been mentored very well with good scientific leadership who have supported them throughout their training, have been trained in manuscript writing, grant writing, have won several grants. So we expected these people not just to leave them like the way that maybe THET is over and just leave them slide by. We expect that these people should continue being catalysts of training in our institutions, yeah, writing grants, as well as support our undergraduate trainees, because there is where we are building up the future of people who will desire and love to do research and work into it. Understanding that research is one of the most important components, the third pillar, as we said, of our universities, and we need it first for capacity building, because through researches we are getting training grants, we are getting to train our teachers. Most of us here, we say, raise hands, most of them have been trained through different kind of research activities. And we are getting career development for all the trainers and teachers at the universities. They get to be published through the research they are mentoring and leading and be promoted. That is quite very important. And we are contributing a lot into the government policy changes through evidence, which we are producing from research activities within the universities and other things. So knowing the importance of research within the universities, that means we need to keep on building the culture of keeping training people. I know that we normally depend with external funding, but now having people within our universities who are trained, let we use them and make them keep on training generations within the universities. I remember when it started before at KSMUCO with MEPI, I was lucky to lead, to mentor 11 MEPI grants at that time. And there is where it was just after my PhD, when I met it in the middle, 2013. And I happened to mentor 11 grants, and there is where I grew and my interest into research. Came MEPI JF, I mentored 2, yeah, who are here, and now they are leading their grants, yeah, and then CYRP, being part of the 24 CYRP, I could see how it developed within the institutions itself, how it has been catalyzed, and moving forward to the generation which is coming up. So I think that the culture of supporting, the culture of mentorship and the peer mentorship within our university should not stop, should be just like catalyzed and starting. And again, there, I think it's there to make this drive and make it go forward so that we keep on even doing more research as ever, because we have more trainees in our universities. We have more disease conditions which are coming up where we needed to investigate and inform the police, especially the current now, the non-communicable disease, because we worked much on the HIV and other infectious disease, but we see now the non-communicable disease, how they come. So we should not sleep, but we should wake up more.
Thank you very much. For research, it's very interesting. I would just want to ask one question related to research. Well, actually, when we talk of research, what is the priority? What is the priority outcome for research? I know you are a very good researcher. Where would you like to? She talked about mentorship, you know, and the retraining and continue, you know. Now I'm asking, as far as research is concerned, which actually is your key priority that you would like to, if you use the mentorship and to cultivate that culture of research? Anyway, you want to say?
If no one will
Okay.
You start.
Yeah, a bit, yeah.
But we'll explain it later, the last few minutes.
Okay.
Yeah, to me, I think this is critical because institutions must have a focus. If you wanted to build the culture of research, is to understand actually this what is in research. In the simple terms, research is a cycle. Research is not the publications. Hapana. Publication is the outcome of that cycle. But the first thing is, how can you make people think kwamba this is a researchable area? That's where we fail. Halafu haya mambo mengine yanafuata. What do we see? Are they researchable? And if they are researchable, what type of research? Ndio mtakuwa kwenye clinical research, whatever, you know. And then, what should I, it is these people to start asking themselves, what should I do in order to research on this? What is required to, kwa hiyo unaendelea hivyo mpaka nafikia, you write a protocol, a researchable protocol. You submit for funding, and you get funds. You do the research, you do the analysis, and finally you publish. It becomes a complete cycle, and this cycle must be sustained. Sasa sikutaka kuuliza swali jingine kwamba, okay, when we talk of sustainability in research, what are the ingredients? Na ziko tatu tu. Hebu tuende kwenye swali la mwisho kwamba it is not uncommon that our institutions, higher learning institutions, operate in silos. Nadhani tunakubaliana. MUHAS is MUHAS. And it may not wish to, to work very closely with other institutions. Labda kama kuna urafiki, naweza kuanza kuulizana. Okay, that's one way. But ndio nasema, if you are working in silos, that's acting as we are competing. MUHAS is competing with KCM Core. KU is competing with KUHAS. Is that healthy? I don't know. So how can we strengthen stakeholder engagement in cultivation of a collaborative spirit amongst the higher learning institution? I think this is a very, very important question, and we must understand if we have to succeed. Sasa hili likuwa nilipe mtu lakini hayupo. I'm throwing it up. Hebu nianze kwa Professor Senga.
Thank you very much. Thank you very much, moderator. To my experience, the best approach to engage stakeholders is first to start with ourselves. We, for instance, conduct these scientific conferences. But in most cases, you see MUHAS scientific conference, you see FUTURE's third scientific conference. Why don't we first start engaging ourselves, have these joint conferences? Because by so doing, it means we are more organized. And we can now confront other stakeholders because we have a big agenda to table to these people. So let's first reorganize ourselves because we are so discreet, ni kama vile hatupendani kabisa yani. But we are all academicians. Why don't we start that thing? Yeah.
Thank you. Dika, can you comment on this?
Yeah, so I think this should not be only taken on the issue of research, but in all other activities. So that what is happening in one institution, you should be aware of what is happening also in that institution, and the communication is key among the institutions. If, for example, you set regulations, you you should also be aware of what other institutions are. Maybe we have a student being discontinued from one university. There should be no way that student to be admitted to another university within. If you know the reason why this student was discontinued from this institution. So if you get, you ignore the reason for being discontinued and then you take that, I think it will not be helping the Tanzanians. Yeah. I think communication is key among the institutions.
Thank you. So let's avoid competition. Let's strengthen our partnerships. Please, Prof.
Yeah, thank you very much. Maybe to add into that, let us look into areas where we can work together and try to invite each other and work together in different areas, like the way you say, even the meeting and conferences, rather than having fragmented and we all put in the same week. Yeah, 3-4 meetings, which we are even lacking the guest of honor because we all wanted to pull one person in one meeting. That has become recently a challenge of having a lot of meeting and activities, and find that some of the meetings are run into loss because the expectations are not met. So collaboratively work and structure and see maybe even if there will be several meetings with different universities, but to structure this kind of meeting can go with this group and this group, but at least to give the space and the schedule for others. But the other thing, I think that all these universities are having a similar or actually same goals of producing competent trainees and students. So we could even try to see how many, there was this FOOCS, yeah, which was established to make sure that university started through MEPI. Yeah, universities are working together, they sit and come closer and decide most of the things together so that they collaboratively work together to discuss some of the things. And this gives a strength of even facing the regulatory authorities in case of any challenges or any issues, to discuss with one voice rather than each institution going and saying differently, and it helps to make a decision which can be healthy in all of the universities.
I think we are all agreeing that we need to work together in order to, actually to be felt, and we will be much even more stronger. But I have one challenge, which I think is an implementation, related to implementation. MOHAS was established by a charter. Kairuki University also has a charter. So is KUHAS, so is KCM Core, etc. So is St. Francis. All of us, we have legal instruments which establish the instrument, and it details what we are supposed to do. And this is a legal requirement. Now, when we are talking of all this liberalization, even of materials, that materials produced KCM Core can be accessed by Kairuki University. How are we going to overcome this hurdle, the legal issue due to the instruments which establish these institutions? Nani anainua mkono huko nyuma to answer this question? I wouldn't mind having somebody comment from there. If it's an issue, then I think we need to, I think is an issue that we need to address. How best can we overcome some of these legal issues which we have them because of the instruments which established our institutions? I think it's critical. Tukiiron out hiyo itatuwezesha to implement some of the issues which we have raised. Any comment from that side? Yes, please, go ahead.
I think that's a good question. The challenge there is there's a lot of competition, but I think for health sciences we need to collaborate one way that we've done successfully with THET is to work through regulatory authorities. For example, TCU. So if there's any initiative, timely involvement of TCU helps. So for instance, now they have taken the matter for curriculum in MD and netting to say, these are the benchmarks. So everybody has to follow that. There's no discussion about that part. So I see that is a platform to keep on working with that, with the ministries of health, Minister of Education, as we've done today. That's my thought.
Thank you very much for that comment. So we are being told, let's bring these regulatory authorities close. Please, I see your hand.
Yeah, thank you very much. Yeah, adding on what Professor Balandi have said, perhaps I start by posing a question. Are we willingly, consciously, clearly to collaborate genuinely? Because if there is a will which is genuine, the issue of regulations were made by us. So these can always be rectified. So I think it starts from ourselves. If we are really willing to genuinely collaborate, bila kufichana na kuviziana, then I think the issue of regulations can just be a challenge rather than an obstacle, so it can be solved.
Asante sana. So we are almost now, we have 5 minutes before. Yeah, I see a hand over there at the back. Umenyosha kwa nguvu sana, na lazima ni, let me pick it up. Na kisha mkumbuke hizi regulatory authorities, kuna TCU ambao tunazungumzia, lakini kuna MCT. Na ukiongea na MCT na TCU. Yes, please, go ahead.
Thank you, Chairperson. I'm called Obadia Nyongole from MOAS. Just to put the record clear, first we must avoid having the so-called historical territorial mindsets for us to make sure that we take this boat ahead towards harmonization of medical or whatever we call health-related education in the country. Without taking away the territorial mindsets, we won't make it. And the issues about our charter, about regulators, I don't think that should not be an escaping gap, because harmonization of health-related education in the country has been championed by the regulators. And I'm aware, as a Vice Chancellor of HKMU, you know that the regulator, which is the Tanzania Commission for Universities, posed the new harmonized, new grading systems for the health-related programs across the country. And that one has been adopted by by all universities in the country. Notwithstanding that we have our charters or regulations at our respective institutions. So I think it's for us to be determined that we want now to start a new chapter of collaboration as key players, as key stakeholders, but also as partners towards improving health education in this country. Thank you so much.
Thank you very much for that iteration. Now, our time is over. I give 1 minute to each of you to comment on any of the 5 questions. If you have an issue that you must put across, please, 1 minute.
Yeah, thank you very much. Maybe to comment on the area of research, the question you asked, that what we can do, I think at the beginning, even if we train or we do research, we need actually to identify a problem or the gaps, looking into also our national priorities, but also priorities at that time, what is going on, so that we could come up with ideas which can make us develop research, but also looking at how the world is to be innovative. yeah, and looking into like currently innovation, things like artificial intelligence, they are coming even for trainings and others. So at least to be innovative so that you can be able to find a critical methodology to approach some of the problems and the challenges which are coming up.
Thank you very much.
Let me comment on staff training. Actually, I sometimes wonder, why is it that MUHAS, with all the years of existence, has not been able to establish a degree or diploma program in medical education? Because we shall never get competent teachers, never. You are a professional in your own field, you are sent to teach, but you are incompetent because you don't have the philosophy and the psychology and all these sciences. So my urge is for MUHAS to take the lead. But the second thing which I wanted to allude to is actually to congratulate MUHAS, KSMC Core, and COAS for showing way how to collaborate. I think let's use this platform and experience to strengthen and expand the collaboration. It can be done. This is what we are seeing here. Thank you.
I'm commenting on the strengthening of research skills of junior researchers. Professor Mbaga has explained much on the mentoring experience, which was mainly done due to availability of grants. So maybe strategic institutions, if the grants are not there, maybe institutions should set funds from their budget for assisting junior researchers, small fund, so that it can be used in case the grants are not there or grants are not sufficient to cover all others.
Thank you very much. We are coming to the end of our time. We are given 45 minutes, and now it's 45 minutes. I think we have to wind up. There may be some questions or the issues which you wanted to raise, but because there is another session going on, I'd rather wind up. Key things is let us collaborate and work together, have common goals. Now THET is there, I think, to facilitate this process. Question of medical education, I think let's think about it very, very seriously. We need to send our staff to go to train, to become educators. And where I was before coming back to Tanzania, we are collaborating with South Africa, and we trained quite a good number of our staff in South Africa, doctors, nurses, to become educators in medical education. The question of sustainability, nimelisikia, limezungumzwa, lakini I wanted to stress three things. When you talk of sustainability, almost everyone anazungumzia, hamna hela. You know, I have no quarrel with that, but I always try to, to change people's mind kwamba money is not the ultimate goal for you to be sustainable. The first thing that you need to have is academic sustainability. Is what you have in your brain to think critically, to be able kuibua issues that can be followed up. Ukisha build here, and this is what our THET is doing, yeah, to train these young staff. Now, hiyo ndio number moja. The second thing is to have the technical sustainability. How they have the brain, they have the skills, they can do it. Lakini they require to be facilitated. This is where you have technicians to support, the training. And then, if you have academic sustainability, na facilities, technical sustainability, hela itakuja kwa sababu this individual ataandika protocol. Italeta hela. Kwa hiyo, let's try to think differently, that it's not money which brings about strength in research, but it is us, the people with academic sustainability. Niwashukuru sana, please let's put our hands together for our presenters. Asanteni sana.
Another round of applause. We are now coming to our very last session, which is the closing ceremony. May I call to the podium Professor Kamugisha, Vice Chancellor, Catholic University, who will be the guest of honor for the closing ceremony. May I call Professor Emmanuel Balandia for the Vice Chancellor Muhas, the host. May I call Professor Gideon Kwesi-Gabo, the Principal Investigator, THET, at the center, sir. May I call Professor Blandina Mbaga. Leo high table imekupenda. May I call Professor Dorini Mloka. May I call Professor Levina Msuya. May I call Professor Stephen Mshana. It is my singular honor, with all protocols observed, to invite Professor Gideon Kwesi-Gabo to invite our guest of honor, Professor Kamugisha, for the official closing of the 30 Grand Symposium. Karibu.
Thank you very much, Dr. Siriri. The guest of honor for this closing ceremony, that is Professor Kamugisha, and all dignitaries sitting on the high table, protocol observed. May I start by thanking everyone for making this event a priority, and that is why you are here, because you made this event a priority. So we thank you very much. And I would like everyone to give a hand of applause to everybody else for you being here. We have learned a lot, and what is promising, this is not the dead end. It is actually the beginning. Without wasting, or maybe without any further ado, I would like now to invite to the podium Professor Kamugisha, who is the VC for KUHAS, to give us closing remarks. Thank you.
Thank you, Professor Kwesi-Gabo. The Vice Chancellors, Principals and Provosts, Deputy Vice Chancellors, Principals and Provosts, the Registrars of Professional Councils, the Principal Investigators for THET, dear participants, good afternoon. We are now approaching the end of the sessions of this grand symposium with the theme, Transforming Health Profession Education in Tanzania. Since morning, we have been having several presentations, but among other things, we have noted that this project have tangible deliverables. And allow me to mention few of those tangible deliverables. The project at the end developed, accredited, sent to the accrediting body, and we have now an accredited. They have disseminated and implemented the 2 harmonized curricula and benchmarks for Doctor of Medicine and Bachelor of Science in Nursing curricula. They provided mentorship to young researchers who are now capable of publishing, but through different presentations, we have heard that some of them are now even winning grants, including NIH grants. They have developed the graduate tracking system, the alumni portal, which is available for use now, at least in those 3 universities to start with. But at the end of the day, they are asking all health training institutions to collaborate, to mimic what they have achieved as the project. They have set a background that we can now use. And today, we have witnessed the launching of THET. The constitution for THET has been distributed to us. More importantly, we got an assurance from the 2 ministries, Ministry of Health, and the Ministry of Education, Science and Technology, that they will be available to support the scale-up of the achievements of the THET project. I understand that in this room, there are representatives or principals or vice chancellors of almost all universities that are involved in health training in Tanzania. Let us use what we have learned today to move forward the training of health in Tanzania. Towards the end, Professor Mashara asked, what is the problem? Why are we not collaborating? And allow me at this point to say that I enjoyed the answer that was given by Dr. Cyril. The genuineness in our daily activities, because TCU will send a team to any institution. This team will be consisting of some people among ourselves. And what the feedback they will send to TCU, you will be surprised. Therefore, are we really ready to collaborate? If they send you as a technical inspection team, and what you write is a report that you cannot actually show to the institution that you have inspected. Therefore, are we really genuinely ready to collaborate? When you approach TCU and the other regulators, I can see the registrar of the Medical Council of Tanganyika is here. But the Medical Council of Tanganyika usually does not visit without some of us. Therefore, let us be genuine. Let us be ready to collaborate. Then we can move. Allow me to thank the THET team. You have shown us the way. Congratulations for this great work. Therefore, at this moment, allow me to thank the guest of honor, who has already left, the organizing committee, the presenters for the presentations they have made, Professor Mashara for the round table discussion, and the 3 institutions and all participants. Now I declare the Grand Symposium closed.